Okay, I'll call the meeting to order, and I would like for everybody to stand for the pledge. Having to locate the flag. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, roll call vote, please.
Alderman Alder. Here. Alderman Flores.
Here.
Alderman Galloway.
Here.
Alderman Poston.
Here.
Alderman Schaefer.
Here.
Alderman Smith is absent. We have 5 aldermen present. We have a quorum.
Let me explain the absence of Alderman Smith. He has a new grandbaby. He's on his way to see that baby in Colorado Springs, and he anticipates getting at the house about 9 or 10 o'clock, in which case he will sign on and he will be live with us on Zoom. He's as prepared for this meeting as anybody can be. So he will be able to vote if and when he signs in, assuming the vote goes past whatever, or is after the time that he gets to where he can sign on Zoom. So that's why there are 5 here. We anticipate a 6th one. So thank you all for your patience. This is an unusual setup for our meeting. We wanted to make sure we had a room as large as possible to accommodate the people that wanted to speak. And so there is the gymnasium. There are people in there. The people that have signed up to speak are in there, and they will be brought in as soon as our 2 first speakers come. There are 2 invited guests that we invited to speak, Dr. Robin Trotman from Cox Health and Dr. Chris Bauman, who's the superintendent of schools. We've asked them to come speak to us first, and then as soon as they are done, then we will call in the public speakers. So, and then we'll have alderman comment and questions and that sort of thing. So, first of all, we need to put the bill on the floor. So, Alderman Poston, I'll turn the floor over to you. Yes, Your Honor. I do not have the agenda in front of me. 3170.
Your Honor, I move to read bill number 3170 by title short description only.
Motion made by Alderman Poston and seconded by Alderman Galloway to put bill 3170 on its first reading. All in favor?
An ordinance of the City of Ozark, Missouri, establishing a requirement for the use of face coverings to prevent or limit the spread of COVID-19.
Okay, I will first start off by welcoming Dr. Robin Trotman from Cox Health to the podium. Thank you, sir.
You're welcome
for coming.
I have a few notes. I don't have my glasses. I believe we're at 6 feet. I'm probably you're the ranking official. I may be the medical official. It seems like it would be appropriate to take the mask off if we're at distance.
Yes. Someone in the back asked for you to speak louder. Sam, can you adjust that at all?
Does that seem appropriate if we're going to be at this distance?
Yes, sir. But I would ask that you speak louder than you normally would. We had to construct and refigure our technology in here for this meeting, and so.
How is this? Can we hear me in the back? Good.
Okay.
So
if at any point you can't hear in the back, would you please just wave? All right, go ahead, Doctor.
Very good. So thanks for letting me come. We've done this in Springfield. It's been done in Taney County. It's a tough decision. It's a tough topic. It's a level of uncertainty that none of us are comfortable with. I've done this every day for 5 months, every day, literally, all day, every day. This is all I've done. Studied, read, reached out to colleagues. I have really nothing to gain by any of these social issues. The altruism and the health is the only reason I'm here today. It's truly out of a spirit of healthcare and wellness of the community. And so people need to understand that first. So I'm going to speak to the healthcare issues. I can't emphasize enough that I don't feel like we have any other options besides what I'm going to call modification of human behavior. So most people are probably up to speed with where this disease is. We have nothing in the near future that's going to bend the curve, that's going to save lives other than modifications of human behavior. So I'm going to tell you about our healthcare system. This specifically doesn't speak to Mercy, but in general it does. I'm in conversation with my contemporaries at Mercy, and their system preparedness would be about the same. Our hospital capacity score today, based on multiple different metrics, looking at volume of patients, our supplies, our testing capacity, public health's ability, is at 6.1 out of 10. So we started nearly at 10. We actually started about 9.7. And so we've had about a 30% decrease in what we would call our capacity score. That's just a metric we're using as we change interventions. We want to follow that prospectively. That is blended with Mercy, and you can see what Greene County's preparedness score looks like. That's what that factors in there, along with public health preparedness. In our hospital, we have 44 patients in the hospital right now. All of these patients are requiring oxygen and they're sick. So these aren't modified diagnoses and people with a broken leg that we're trying to game the system. These are 40 patients that are sick, requiring hospitalization. And what we've learned, our hospitalization rate per patient has probably improved. We're discharging patients earlier and we're managing patients at home. So the proportion of people that end up in the hospital today looks different than it did before. Length of stay has improved versus 3 months ago because we send people home earlier. We send them home on oxygen and we know more about the disease. So right now, that's the status. We have probably 7 or 8 patients critically ill in the ICU on ventilators. Mercy is roughly the same. We usually jockey within 1 or 2 patients. Some of the numbers that I follow prospectively are our positivity rate in symptomatic patients. And what that tells us is how well we're testing and how prepared we are. There's sort of an industry standard number where people would say, if your positivity rate of symptomatic people is over 10%, you're not testing enough. You're not doing enough. So our positivity rate over 7-day rolling average, so every day, 7 days, you move that average forward, is about 20%, 19 and a few. And what we have is about 40 to 70 positive tests per day. So you can look at how many Greene County does, how many Cox and Mercy do, and whatever that delta is, that's probably about the surrounding community number of cases. So right now I spend the majority of my time in the ICU. I just left the ICU. It's a terrible situation. You have to understand these patients are isolated. We're doing phone conversations with granddaughters and patients at end of life. That's the reality that I'm trying to depict here. This isn't rhetoric. This isn't political jargon. This isn't the flu. I've worked here for 15 years. I've worked through every flu season, including 2009, and this is different. So that's the context. That's the background of the healthcare system. So as we've hit our highest number of cases, I want to give you the background on the preparedness of the healthcare system and most likely public health. I can't speak specifically to Christian County Health Department. I know you've met with them. They're strapped, but these are the capacities right now. This is what, with 100% certainty, if we continue to have rise in cases in the region, these are the resources that will be depleted in our hospital. This isn't rhetoric. This is projected resource depletion, meaning zero. We will run out of remdesivir, which is about the only antiviral medicine we have that seems to improve people's outcomes when we're on the ventilator. We're not going to have enough. So at the current rate, we're going through 5 to 6 patients per day. It's on allocation through the government. We're not going to have those treatments. And I can tell you, in 5 months of doing this every day, all day, staying up on the literature, there is some hope in these treatments. So some of the combinations of the treatments that we use, patients do better. With 100% certainty, fewer critically ill patients are dying today than were 3 months ago. The same patient would have presented 3 months ago. We now know how to manage them. We know interventions to keep the breathing tube out, and we have some of these therapies. And these therapies are at risk. With 100% certainty, the projected rate, if it's not mitigated, we won't have these. We won't have staff. We're already looking to hire. We have a high attrition rate. This is hard work. These staff are in the ICUs all day. I'm watching them cry in a face mask as we have end-of-life conversations with grandchildren on an iPhone. So that was today, and that's most days we have events like that. So that's the humanity of this. It's not political. It's truly a humanity issue. And our PPE is not threatened today, but when the cold comes, when whooping cough, RSV, those sort of things that we see in the winter, when those come, with 100% certainty, our supply chain of appropriate PPE in the hospital would be depleted at the current rate. So we could not manage the same number of COVID patients or more, plus influenza, plus RSV. Our supplies would be tapped out, and we would look like we saw in March in Lombard, Italy, and where healthcare workers were becoming sick. So right now things look good. Our outcomes are much better. We're learning how to do this. We're learning how to care for the elderly and keep them in the nursing home. That's been a big deal. So having the nursing home on lockdown, you know, our first bad incident was one nursing home where we had quite a few deaths. So as we learn a lot and we talk about mortality, I want to pivot to something else that's background in my mind. I follow death rate, I follow total number of deaths, but that's not the only metric that we use. There was just a paper in JAMA that looked at people who are in the hospital for COVID. Almost 80% have symptoms 2 months later. So 40 some odd percent still have shortness of breath and haven't returned to work. So when we want to talk about economic impacts, you have a severe case of COVID, you're over a certain age, you're not coming back to work based on the literature so far. So there is economic impact just based on the severity of the illness. We're not returning people to work the next day like we would with a cold. Your fever's gone, 24 hours, you can go back to work with the flu. We're not seeing that. That's not capable. Now, a lot of people have a positive test and have minimal symptoms. So there are those people, but I'm talking about of the people who become sick. I think the other thing that we need to follow is our public health. Our public health departments are totally tapped out. In your county here, for sure, we're not able to do public health tracings. So the idea would be if somebody gets diagnosed, they're contacted, they're isolated, they do contact tracings, and then you run down those contacts, and then they are quarantined. That is the cornerstone. That is behavioral modification. That's the first step, and we're not doing that right now. So our local counties are behind in contact tracings, and that's all we have. So we have nothing else. We have physical distancing, facial coverings, contact tracings, and isolation. That's it. And if your public health department is overwhelmed, and we want to continue to run at a certain bit of normalcy, I can tell you with 100% certainty there's nothing else we can do. We can keep our physical distance. We can try to lift up our public health department. We can try to procure testing resources, and we can use facial coverings. So we're going to pivot into your county. I can tell you that this county is overwhelmed. We're leaning in, trying to help them do contact tracings, but we're behind. We'd like to be able to identify those people on the first day. But once cases reach a certain number of cases, and I think you guys probably have those numbers as well as I do. Once schools are open, we're trying to keep life normal. I want life to be normal. I want to be able to go to restaurants. We don't have very many other interventions, and I would implore on anybody to mention one of these interventions and give me some data supporting that besides facial coverings and physical distancing, because there's really been nothing else proven across the globe to bend this curve. I can tell you that we talk about things about civil liberties. I'm going to leave that alone, but I do want to read a paper from the JAMA Network, and this is just one paragraph. And it says, public health officials and leaders need to ensure that the public understands clearly when and how to wear cloth facial coverings properly and continue building the evidence base for their effectiveness. Second, although cloth face coverings are generally well tolerated for short periods, with prolonged use, they can be irritating or difficult for some people to breathe through, especially in hot, humid days. Innovation is needed to ensure physical comfort and ease. Third, the public needs consistent and clear and appealing messaging that normalizes community masking. At this critical juncture, when COVID-19 is resurging, broad adoption of cloth face coverings is a key civic duty. So that was written in JAMA. That's an editorial. And then it goes on to talk about a notion that I think is interesting when we talk about hedonistic adaptions. We start to adapt to what is normal. We adapt to wearing shoes in restaurants. We don't argue about that. We adapt to wearing a seatbelt. I wish there was a way to ensure that adherence was over a certain percent. We can say it's 70%. I would argue it's not. That hadn't been shown in the literature, that anything other than suggestions, that anything less than suggestions is effective. So I personally haven't witnessed 70% in most communities, but I know there will be differences on that. So what I suspect that we should probably think about is the science and the lack of alternatives. So the science predicts that wearing a facial covering works. I'm sure there's going to be debates, there's going to be memes, there's going to be pictures. That is not the evidence that we look for. We look for evidence that shows that if I cough, large respiratory droplets are captured in this thing on my face. And that's pretty well accepted in science now. And our Great Clips exposure was very compelling. So if you're not familiar, the two hairdressers, they were sick with COVID-19. Everybody wore a face mask. Nobody got sick. And we tested a lot of those people, and we even looked for their contacts, and nobody was sick. I was aware of this case and this potential threat on day one, on a Saturday. We expected 5 to 10 people to be sick from this exposure, just based on the normal reproductive number, and we saw 0. So to me, that was so compelling that we published that in MMWR, and that was the #1 paper in the world for 3 days based on how it's reproduced, how it's goes through social media, and how it's cited. So the world felt that to be a very compelling case. So I think we need to pull evidence like that. We need to pull exposures where we know it didn't happen. In Branson, I can tell you what a healthcare worker, if they're exposed without a facial covering and with, I can tell you how often they get sick. We've had a large exposure. So I'm probably going to leave it at that because I know there'll be questions. I think the main things we need to focus on as we make this decision is what are our options? Do we have options otherwise? And I would argue that at this point, physical distancing, not shutting down our economy, and facial coverings are about all we have. Uplifting our public health department and hanging in there. The vaccine looks like best case for some populations, maybe the end of the year. It's moving up incredibly fast, and I'm hopeful there. So I'll probably leave it at that. If there's questions, I'm sure there are.
Chandra, help me identify. Are there any questions from the Alderman? Okay.
Yes, Dr. Trump, I have one question.
Can you pick up the mic?
Sure.
And talk loud.
Is many people that had COVID, even if they had mild symptoms, have effects that linger after their COVID is no longer there. Has this been around long enough yet that we know whether those effects, the heart damage, the lung damage, are healing over time, or do we know if they're going to stick around for years, perhaps the life of that person?
So the uncertainty that you just cited is what keeps me up at night. So the long-term uncertainty is unknown. Most people make a full recovery. The myocarditis, if you have myocarditis from this virus, there's a good chance you could take a hit and your heart won't function the same way. We're not seeing that as much as we had originally feared. We're not seeing encephalitis like we do with influenza. I have a patient who's losing a leg this week. So there is vascular disease. There are people that have blood clots to the lung, and their capacity and function's not coming back. The majority of people that have a mild illness, lasting long-term consequences, probably not. But again, that's that uncertainty that keeps me up at night. I don't know.
Thank you, sir.
Mr. Schaefer, Mr. Galloway.
Doctor, thank you for taking time to answer some of our questions. My understanding is the mass ordinances before us tonight is to try to limit community spread. Is that accurate?
Check. All spread. Yes, all spread. Yep.
The community spread is not the majority of the cases that are being seen in the hospitals, for example. Usually majority of the cases are from constant contact with an individual sick, either through a home or cohabitation or place of employment, those type of things. Is that true?
So community spread has 2 points when you define it community spread. Right up front, if you know you were around somebody and you say, that's my source, or 5 days later when the person you were around also has symptoms. So I can tell you that when I see somebody in the hospital, I've seen 130 people in the hospital. It's very rare that I talk to somebody and I can't identify a source. I may not know a direct patient, but they'll say, I was at church, no one at church has been sick, no one wore a mask, and now my husband and I are sick. So that would be defined as community spread, but if there's subsequent cases linked to that. So community spread really is about at the time of when you see them versus 3 weeks later having all the data in front of you.
Okay. If there's an unmasked individual within 6 feet of a sick individual, can you tell me the odds of that unmasked individual getting sick?
No.
If that individual's wearing a mask and he's around a sick individual, can you tell me the odds?
It's less.
But do you know how much less?
No. So there are images from the CDC. I can't quote those numbers. It goes 30, 40, it goes down in these numbers. It's proportionally, it goes down based on each side wearing a mask. Offhand, I don't remember what those numbers are. It's on the CDC's website.
The Great Clip study that you cited,
Mhm.
there were 137 contacts, is that correct?
Sure.
But we've only like 96 were followed up with. I mean, there were 40
No.
or some.
No.
Each and every one.
We reached out to, we didn't, the health department reached out to all those people. They didn't test everybody.
Okay.
Not every single person who got a haircut that day, but none of those people who did have a haircut came up with a positive test. So yeah, I mean, it's as good of an experiment as you could possibly get, where you have a line list and a time. But no, we didn't have 100% follow-up. They didn't.
I've been a proponent of voluntary compliance through education and distribution of masks. That I've seen numbers that, like you quoted, around 70% for voluntary compliance. You're really just, without getting into the argument to the benefit of the mask, do you not believe that a voluntary compliance practice would work? That the city put in the necessary resources to educate the public, provide the means to work with the city businesses, that we couldn't get a compliance rate up or near what you would find?
Yeah, I don't know. I'd like to think so. I'd like to think that altruism and civic duty would. I mean, I've been in a store and ridiculed. My daughter's been ridiculed in a store for wearing a mask. So I'm a little skeptical at times that we're going to get the numbers needed to slow down the acceleration. I think the message has been out there. If we're not there by now, I don't know how people wouldn't have gotten. To your point, the supplies, the messaging, real time, those would all be key in doing an intervention like that. But yeah, I don't know. It's an experiment. It's a social experiment. You can look at the state of Kansas, where it's been brought back in certain areas and rolled out in certain areas. And we'll be able to look at those data, and that'll probably inform us on how that looks in more of a controlled situation.
Are you in favor of mandated vaccination if vaccine is developed?
If it's a public health issue and you're going to be in a high congregate area, yes. Vaccines shouldn't be mandated if they're for your health. But if it's for a disease that has altruism, public health, and it's safe, and you're going to be in a setting where other people in aggregate have decided that's the ecosystem that they want, then yes.
Thank you, sir.
Yep.
Galloway.
Thank you, Your Honor. I had a couple questions from your remarks earlier, then some concerns that I've heard from other aldermen that I'd like you to address. I think that you had mentioned that it has been said that as far as testing, that if you're on the positivity rate, if it's greater than 10%, you're not testing enough, and we're at 20% positivity. What are you getting at there?
What it means is if you are seeing a positivity rate of symptomatic people of over 10%, you need to be testing more. You should have more negative tests. You should be missing cases. What it means is your disease is ramping up so fast that you're missing cases out here, right? So if you're at 10%, not 5%, if you're at 5%, you're missing a lot of cases. You're testing people who are negative, and you're not missing cases because you're testing a sufficient amount. See, you're casting a big enough net. If you're casting, this analogy is going to fall apart, so I'm not going to use fishing, but if your positivity rate is 20%, you're not testing enough. That means there's other people out here, and you're not casting a big enough net. You're missing people because you have too high of a proportion of positive tests. So, I mean, there's no dogma, there's no magic number of 10%, but I can tell you that this is a number that public health authorities use around the country. Hospitals really, healthcare systems really quiver when they see a 20% positivity rate for our healthcare system.
Okay, so 10% is the benchmark in your trade.
Less than 10% means you're probably testing enough. And we rolled at 2% for a long time and felt pretty good. We were having 10 positives a day. We were able to get people in and out of the system, and you can feel the healthcare system, the public health, the tracers that work at the health department, they can feel what 20% looks like. So I can validate it only empirically.
So when you
Anecdotally.
say that we're testing at 20% positivity, the implication is that there are a lot more positives that we don't know about?
Yes. So if your rate is 20%, you need to be testing more because you're missing other cases out here. So maybe you're doing 3 tests for every 1 positive on the outside, 4 tests, 5 tests. You're not doing enough testing. Most likely it's because you've hit your capacity. So we've hit our capacity. We can't, the local public health departments can't test anymore for multiple reasons. We can get into the supply chain of tests. The turnaround time for tests are abysmal. Everybody knows about that. In-house testing is not a realistic expectation for community hospitals. We're working on that. We're working with the state. When we had that capacity, we might be able to test enough that we might have only a few more cases, but a lower positivity rate. So you can't, basic reproductive number of 2.5 is never going to come down to 1 until you've identified these other undiagnosed people out in the community.
So as a policymaker, hear the figure 20% positivity, that would tell me that there's a lot more cases than is understood.
For sure. That's exactly what that means. There are undiagnosed cases, mildly symptomatic or asymptomatic or pre-symptomatic at that moment in time. If you have a 20% positivity rate, that would imply that.
And that's important because there are people at risk and it's more likely to hit them if you
Sure.
have a larger number of positive, asymptomatic, mildly symptomatic.
And we do those tracings. We find somebody who's infected, we cast this net and we test the people around them. And you have a nursing home with 3 elderly patients that get sick, you'll find the healthcare worker that brought it in. So maybe you haven't tested that healthcare worker. So now you're going to test 50 healthcare workers and you're going to get 1 positive. You could see how your percent positivity just went down, but you solved the case. So had you been able to test that entire ecosystem of the nursing home, you would have a lower positivity rate. You'd have about the same number of cases, maybe 1 or 2 more, but you would have found the source.
Okay, so that's one thing you're asking the policymaker to look at is, look, we have a 20% positivity rate. That means we have a much bigger problem than our data is able to support.
Sure. And that positivity rate is going to reflect subsequent positive cases, the absolute number of cases the following weeks.
What are we to make, if anything, about the increase in reported cases in Christian County? You had referenced it in your discussion. I was looking at Dr. Karen Peake's email to us from just a few minutes ago. She had mentioned that we started in July with a certain number of cases and through the history of COVID, and then we went and surpassed that number in a month. And she had told me when I was talking to her on the phone on Friday that in the past 3 days, less than 3 days, they had 67 cases, and that was a big jump. Now, is the fact that it's jumping, is that an indication that we're just testing more and we're picking up more people? Or is that a number that we should be concerned about, the fact that it's increasing kind of at a high rate?
So we look at your doubling time, right? So how many days between when you had 10 cases and when you had 20? How many days is that? And you can take it the next day if you have 15 cases, and you can go when you went to 30. So you look at that time. So that doubling time starts to shorten. I don't have specific Christian County data, but I have a little bit of an update. And so I can say as of July 1st, there were 56 cases. Now there's, I think, 400 cases in 40 days, and then 21 cases over the weekend. I don't think it's due to increased testing because your health department doesn't have broad testing capacity. So, I mean, I don't know where a disproportionate number of positive tests would have come from. Does that make sense?
So it would be valid to look at those increased numbers as an indication that we have something that's on the rise?
You do, yes. In this county, you do have disease on the rise. I can tell you that our hospitalization rate represented from Christian County, Taney County, Greene County. So whatever our catchment is, whatever fraction of Cox Health patients Christian County is, it's about 10, 12% of our hospitalizations in the last few weeks.
I think you touched on a criticism that's been raised by comparing this to the flu, and you said that there was no comparison. And I think I saw a meme that said, well, we didn't have masks during the swine flu. Can you elaborate a little bit? I mean, what is really the difference between this and a flu epidemic that we've had in the past?
So here's the major distinctions between this and influenza. We don't have Tamiflu. Tamiflu works. That's an antiviral medicine, shortens the duration of illness. We give it to people who are critically ill in the hospital, and they don't die as often. I can tell you, 15 years here, going through 2009, H1N1, I didn't see this many people with this bad of hypoxemia in the ER, in the ICU. So the disease is different. The treatment lacks. The drugs are not as good. The regimen that we use, putting people face down, prone, steroids, all of those things, those don't work as well as treatments for influenza. We have a naive immune system, right? So people have been vaccinated or they've had influenza year after year. So you have a repertoire, you have a body of antibodies that may not be specific for that flu, but they do cross-react and confer some protection. So this year you have there are some people that have some degree of non-neutralizing antibodies from other coronaviruses, but they're not protective. Your antibodies to when you got the flu 4 years ago or when you had the vaccine last year are protective to some degree against next year's. We need to boost it and modify it a little bit. So those are the major distinctions. This virus really parasitizes the entire respiratory tract. So it infects, as opposed to MERS or SARS, the SARS that was in Toronto, that really parasitized the lungs. So when somebody got sick, the healthcare worker sees them late in the disease and they cough on them, high inoculum. That's why healthcare workers died from SARS. This presents a little earlier, so you might have other symptoms besides pneumonia. So with SARS-CoV-2, pneumonia is the end of it, but there's a continuum in between. So those are the major distinctions. And I can tell you that I just haven't had this much mystery. I haven't had this much asymptomatic transmission of any disease, really. I've never seen a disease that has this much asymptomatic transmission. Somebody's infected and you go back and you do tracings and you test somebody back here and they had it. And so you have two people that were asymptomatic, but they're linked to somebody who died here. So that's the uniqueness of this virus. Typically with influenza, somebody would have a runny nose and a fever along the line. So those are the scary things. The treatments aren't as good. The antibodies, the pre-existing antibodies don't exist, and the asymptomatic transmission are what make us nervous.
And I'm just following your line of thought, thinking that would be why other countries have such difficulty with it, with their hospitals being swamped and high death rates. Is that it is different from the flu? It is more lethal.
Well,
and more debilitating.
Yeah. So infection fatality rate in certain populations is probably more lethal. So infection meaning you have it, you get diagnosed, not maybe case fatality rate, not somebody that we think had it, but if you end up in the hospital and you're older, your chance of dying is very high. And that goes up with each decile of age. So I forget what the numbers are, but it's 40% if you're over 80. That's about what we're seeing.
And from a public health standpoint, I guess why you're here is you're trying to protect your hospital from getting swamped. Is that why you mentioned that they're cumulatively, if you have the flu season coming and you have other bugs that are out there that are filling up your hospital, you may not be able to cope with other life-threatening conditions? Is that what the harm that you're trying to prevent?
At the accelerated rate right now, we won't. So we won't have that capacity.
You will not?
We will not.
No question in your mind?
No, I mean, you can just lay over our influenza and RSV admissions, lay them over COVID at the rate of increase of new cases, and there will not be stuff, staff, and space. That's the word I use. Stuff meaning PPE, supplies, drugs, staff meaning healthcare workers, and physical space. So if you take our influenza numbers, you take RSV, and you lay them over on top of COVID-19 at the rate we're going, not too much far from where we are now. If we were to have a surge of patients right now with influenza, we would be at capacity. We would be near crisis. I mean, if we, not because of the physical space, we built a 51-bed ICU. We have 30 beds left. People say there's room in the parking lot, right? So that means your system's not stressed. Your system's stressed if you don't have enough humans in there to take care of people, or if you don't have enough respirators. And that's our vulnerabilities right now. So I can tell you, if you overlay our cough and cold influenza season numbers right now onto COVID-19, we would be in crisis.
Okay, so I'm not in your business, so I have to kind of rely on what you're saying. You're saying you're on track to being at overcapacity as we're going right now.
Yes. Yeah, at the rate of increase of disease, if we don't see something slow down the proportion of new cases, and you overlay the cough and cold season onto this fall and winter, yes, it would be crisis. And I can't think of another intervention. I would beg people to give us that intervention besides what we've already done, but it's human behavior. That's all we have.
So I want to move to concerns that I've heard from Alderman, and then I read all my emails from citizens. One concern is, well, we simply just don't have the data to be able to confidently say things like you just said. But I think you were saying you do, and those are, I just want to go through, I know the two of them, you told me the 20% positivity rate, and then the other is the fact that in counties where their counting ability or their tracing abilities are pretty low, they're seeing a rapid rise in cases. What other data would you point to? If there is any.
Data for
your proposition that you're heading straight headlong into a crisis.
Oh, well, I mean, it is, I don't think it's really a leap to take what was last year's hospital census data for influenza, cough and cold admissions, COPD exacerbations, put them on top of our current hospital admissions for COVID-19, and our hospital is full. There's not room in the end. Like that's just doing the accounting. I don't think we're going to stop getting fewer people with broken legs and brain aneurysms and heart attacks. That's not going to happen. And we have to continue to take care of those people the best we can, and we can't compromise what we're doing. And so, yeah, it's just a mathematical number. Look at your census of your hospital in the winter and overlay that on top of influenza. This is what everybody in the country is scrambling for. This is what keeps healthcare systems up at night, is how to be ready for that.
So your position from your work is, no, the data is already here. We know we have to act. That's why I'm here. Another concern is that, well, the CDC is only recommending people wearing masks, implying that they're not mandating it. So what does the CDC know that Cox Hospital Systems know? Doesn't know, or vice versa.
So the CDC is not an enforcement arm of the government, right? I mean, they don't, what do they actually enforce? I'm not aware of them writing laws. And
so what you're saying is, as a policy organization,
there's a lot of things that we do that the CDC recommends. There's things we do, there's things we don't do. There's things with masking policies that we're not able to do. Early on, it said everybody should wear an N95 mask for all encounters with COVID. The science has evolved. We know you don't have to wear an actual respirator for a patient in certain situations. So CDC puts out guidance, they put out recommendations.
Well, I guess what I'm trying to gather from, or I'm trying to understand the criticism, but maybe just to push it a little further. I think Mississippi has a mandated mask law. There are other states as well. Are they way out there from the CDC, or is there just not I mean, is it a fair criticism?
No,
CDC is not
I like the way this works. CDC is a scientific community. They give guidance, and then civic leaders look at the guidance, they look at the science, and they implement change for their constituents. And so if it were up to me, you would look at your prevalence in your community, and you would say, if we've never had a COVID patient in our community and our hospitals are open, then I would say, let's not have this conversation. I 100% agree with their recommendation. They recommend people not smoke. They don't make it a law not to smoke. They say smoking's bad. CDC is not a lock-in. They don't have keys to the car, so to speak.
I understand. So I think what you're saying is, well, when they recommend that as a policymaker, you have to look at that recommendation and then determine, well, how do we get to people wearing masks, whether
Yes,
that's
yep.
going to be by education or by mandate.
So they say that if your situation warrants it, you should encourage mask. They don't say, what's your percent? I mean, they're not going to get that granular in their recs where they would say, mandated if 20% positivity rate and this doctor says his hospital's full. That's not how they ever work. They say, here's the best science, and it might change. But I think what they do is they inform us that these are the interventions, and then you look at your prevalence and the rate of increase, and then you implement that how you need to. That's my interpretation of how the CDC works in general.
So I'm going down my list of concerns that were raised.
Yep.
So I apologize if you're, I'm going to keep you up there forever. Yeah, probably.
I haven't touched this one tick yet. I'm not ready. Okay, all right. Suffering.
It's not very often I get to question an epidemiologist, so I'm
Yeah,
taking
sure.
advantage. Well, I guess the next question has to do, or next concern has to do with compliance. And in your remarks, you touched on it, and the question is, well, you know, what were the numbers before there was a mask mandate versus what's after? So we've had Springfield with a mask mandate. Have you received feedback on that in terms of what the general consensus is as to whether
Sure.
that raised compliance or not?
Sure. So you're going to look at the acceleration of new cases pre and post mask ordinance in Springfield. That's the number you want to know. So what's the rate of increase? And so here's the unfortunate part of the story that's a major confounder in the data. We have a prison, we have a jail that has 40 some odd cases. If you subtract the jail, then it's gone from, I think it was 22% to, I think it was 6 or 8%. I had Clay Goddard email me that. So 8% overall growth over a 7-day rolling average. So if you were to go and look on their website and you look at that July 16th and you look at the blue bar rate of new cases and you take the slope of that line of new cases and then you put that intervention in, what you see is it goes like that. So they're still getting cases, but the rate of increase of new cases is becoming manageable. If they have 50 cases a day, their tracers can handle that and they can contain it. If they have 80 cases a day, they don't have enough employees to do contact tracings. If your county has 30 new cases a day, they don't have the contact tracers to do that. So the masking ordinance, when it was put in place, empirical evidence would say that the number of new cases has slowed down, the rate of increase. And that's about the best number you can look at.
So what you're saying, and you know, from an anecdotal perspective, I noticed that at Walmart it was about 50-50 before Walmart mandated it. Now it's just maybe 2 or 3 people when I go there that are unmasked. But you're taking it from the different perspective, which is, well, we are seeing these numbers go down now that we have the mask ordinance, so we're inferring that we're seeing greater compliance because we know the masks work.
There was no other intervention. You know, our population didn't decrease in Springfield. There was no other intervention that coincided with that date. And that's all I'm worried about. You know, what the uptick is in the community is a surrogate for what we're trying to do, which is keep people out of the hospital and save lives. And however that ends up working, whether it's 2 people in Walmart or 100 people in Walmart, I don't really care, as long as I know that the health department can do the contact tracings and identify these people and keep our hospital from being swamped.
another concern cannot be effectively enforced. Go ahead.
No, I can listen.
Okay. How does Springfield enforce it, or is it basically relying on people's general law
Yeah,
about nature
I don't
to
know.
follow?
You'd have to
follow
talk to Clay and
Yeah.
those people.
I understand. Next question, or next concern. I never quite understood this concern, but I've heard it 3 times from a very intelligent friend, so maybe you can shed light on it. How do we know, we shouldn't enact this because we don't know when we would ever release it, that we would get people to say, okay, you don't have to mask. What would be, I guess, our framework?
Yeah, so you're asking for a epidemiologic consult for how that would look on paper. And I would say that it's what's your outcome? What are you trying to accomplish? Are you trying to accomplish, imperialistic mask enforcement, or are you trying to save lives? So if you see lives getting better, if you see fewer new cases, that's your marker that you're on the right track. I wouldn't use things like enforcement or citations or any of these surrogates. The goal is to slow down the rise of new cases. So when you see that plateau through what we call 2 replication, 3 replication cycles, where you're kind of out of the woods of this exponential increase, which is kind of what we're seeing in some of these communities. If you see you're out of that after maybe 4 weeks, then you can probably start to pull back, just like we did with the shelter in place. I mean, when you look at our data, had we not done that intervention back then, we would be New Jersey, we'd be Lombard, Italy. I mean, that's the rate of acceleration. So that worked. Now, how long do you keep your foot on the gas there? I don't know. But if you had to ask me for a recommendation, I would say you had a 6 to 8 week time period where you reassess and you look at your hospital capacity, you look at your local public health capacity. Are they able to do the contact tracings? And you look at your increase in rate of new cases.
Worst case scenario, we're abiding with the mask ordinance you are proposing. We would be buying time till we got to the vaccine, assuming that works out.
I mean, maybe not. There are other places in the world that are managing this as a chronic disease. So I don't think we can really do anything until the vaccine is available, because that's a big question mark. And I would hate to have an intervention in place whose endpoint is a question mark. Does that make sense? I would rather have something objective out there where we said, we need to do something. And I'm not advocating for a civic ordinance for a mask. I'm here to inform you on what's the situation and what's the predictable outcome. But I can tell you that I would rather have some sort of objective endpoint that was transparent and was empirical and was shared by everybody involved. And to me, that would be illnesses, capacity, things like that.
The CDC, this is, I'm just reading directly from concern. CDC says that masks wearing may give for people a false sense of security, and with wearing cloth masks. Not sure that I quite understand that.
Yeah.
Are there is the CDC saying there's drawbacks to wearing a mask? Or?
Sure. A mask is not the solution here. The solution is multifaceted. It's all those same 4 things we've talked about: hand hygiene, physical distancing, facial coverings, contact tracings. It's all part of those. So yes, a cloth mask, a bandana is not 100% effective at all times. It's just not. And that's not a secret. And you're not going to get anybody doing the science that's going to say a bandana around the face is going to 100% protect somebody from getting this disease. but it's, what if it works 50%? Well, 50% would put us at a 10% number of positivity rate, which would make us feel a lot more comfortable, and I might not be here. So even if it was 50% effective, it just adds to the arsenal of interventions. All we have are human behaviors. That's all I can keep going back to. We have nothing but human behavior modification, nothing. And it's just one piece.
And I guess you would observe that, well, Mass must be doing something because you've already seen an immediate effect out of Springfield's mandate.
And we've seen it in other places. And there, at a certain point in time, you have to just stop biting off little pieces of data, and you have to say, if you know that something physically works, and you're going to not do it because you have to show me in my county, it's just not going to work. At a certain point in time, we have to trust the science, look at the examples, and rely on the only thing we have.
Okay, so I want to switch tack to something specific to our ordinance. On children wearing masks, is there science as to what age that should be mandated? No.
I don't know.
Yeah, okay.
I mean, I know a lot. I don't know the right answer to inform you right now. I know the people that do. And so if I can help you with that in any way, I have contacts that I rely on for my pediatric questions. But, you know, there's good news. Young children don't transmit to adults as much as we thought. So that's good news. That makes me feel safer for our teachers as we re-enter school. Older kids do. Teenagers probably at about the same rate they transmit. But little kids probably don't transmit to adults as much as we originally feared.
Teenagers being
Teenagers do, yeah. Probably that junior high cutoff is what my pediatric expert colleagues would tell me.
Interesting. Okay, thank you very much for entertaining my questions.
All right, any other questions from the Alderman?
I just have a couple.
Yes, Mr. Flores.
Now, last time we spoke to our health department here in Christian County, they said that thus far we'd sent 5 people to the hospital from our entire county. So we're saying, you're seeing an increase no matter what, and you're seeing an increase across the board. Do we know how much certain counties are being affected more than others? And if we're seeing a slowdown in Springfield right now, and we know we've sent 5 thus far, and this is just an honest question.
Yeah.
Are we not seeing a slowdown here considering we have more and more people wearing masks? Because no one was wearing masks, a month or 2 ago.
Yeah.
And so I just didn't know if you're seeing that.
We've
effect
had,
all around.
I mean, there's been more than 5 hospitalizations from this county, because I can tell you, if it's 10 to 12% of 200 hospitalizations, I mean, you can do the math.
I'm just staying with what our health department's telling us.
As of today, they say only 5 people from
Last time, which was only a week or 2 ago.
Yeah,
It was at 5.
Yeah.
So that's the only reason why I'm asking, is because
We just go by if I haven't pulled the data on the state, we can tell you what state. I mean, we have, I can't pull the numbers off the top of my head, but I guess your point is, if Springfield's going down, does that mean Christian has disproportionately gone up to occupy that percent? Is that what you're saying?
Exactly, yeah. That's what I'm trying to figure out here is just.
Well, but Taney County's had a bunch of cases, and one thing I'll tell you is we have not been over. There's been a fear. We had a fear that we were going to be overrun from Joplin, and that we were going to be overrun from Northwest Arkansas, and we haven't seen that. The CDC was boots on the ground in that area of the country, and they contained that. And you can look into their ordinances there. But we haven't seen that overflow. We've seen a lot more from the surrounding counties. And I can get the county breakdown for our hospitalizations.
Gotcha. I guess my only other question would be, so you're not necessarily for fines or penalties for this, but you're for implementing.
Yeah, that's the question. And I wish I could be not so wishy-washy. I don't know what a good ordinance looks like. I can tell you what works. I get the luxury of just being the healthcare person, and you guys have to make the hard decisions. I don't know what that would look. What I would probably recommend is do what other people have done that have worked. And then let's have this conversation in 6 to 8 weeks and see if it worked. If it didn't work, if your cases are down and you got whatever, nobody wears a mask yet the cases go down, then we're on to something. Let's look at that. So I'm open to any evidence that results in better outcomes, whether that's criminal fines. I don't want to talk to that.
Thank you.
You're welcome.
All right. Heather? All right. Are there any other questions of Dr. Trotman?
That's all.
Apparently not. Thank you very much.
You're welcome. What do you say?
I think he said Nix's number.
Nixon?
The way that this meeting operates, and I appreciate the concern. If you are a speaker, you have to address the board. Dr. Trotman is the only speaker right now. I will entertain that one question, but that's the last one from the audience. Are you aware of any?
Well, I don't know
that
we can track them specifically by the city.
Okay.
Your health department could probably get those data, but I don't have data by the city.
Okay, I didn't think so, but I had to
Yeah.
ask. All right, thank you very much. All right, the next invited speaker we have is Dr. Chris Bauman, Superintendent of Schools here at Ozark. And Dr. Bauman, take it away.
Thank you, Mayor Gardner, Board of Aldermen. I appreciate the opportunity to be able to come up and speak with you today. I know we all have toiled over this for a long time. There has been, I'm sure for you guys since March, the amount of recommendations that have piled up upon us would be enough to fill up this room. So I can appreciate the position that you're in. We too, as a school district, have been laboring over these issues. And so I appreciate your willingness to do this tonight, to listen, to look at the information, to make a calculated and thoughtful decision. And so I so much appreciate the opportunity to be able to address you and talk about the situation at the school. And really, this is about where the city and the school come together. And as you guys well know, we have worked very hard as a partnership between the school district and the city. We don't necessarily in any entity always agree on everything, but I do know one area that we agree upon is that we all care very much about this community and that we very much want the best for the citizens, the students, the parents, the businesses across the community. So I know that we all share in that for sure. I just very quickly want to take you through the process that the school district has gone through as we've made these decisions and really talk about, I think, where the school district and the city truly come together on this important issue. So to start with, as you guys well know, in March, there was a lot of things that came down all at once and things changed very, very rapidly. And you, like us, were put in very difficult positions. You labored over some extremely difficult decisions as you looked at stay-at-home orders and closing businesses and who is essential and who is not essential. And we had to make the decision to close our doors to students, send them home, do things that we had not ever expected to have to be able to do. And yet we all stepped up and did what we felt was best at the time with the information that we were given. And I applaud you for that. And as the school, I thought that they did a great job. But as we ended in May with our school year and we rolled into June, we began looking at what does our summer school look like? What does fall school look like as we come back? And as you guys know, we were all talking about coming back, doing the backing off order. We were starting to open things up. We were letting businesses open up. The school district was doing the same thing. We knew it was imperative to get our students back in front of our teachers because if you talk about the social emotional impact on our students, they needed to be back in the classroom. So we did the maximum that we thought that we could do. So in summer school, we brought back K-8 because at summer school, we had the ability to socially distance. Our buildings are not as full. So we were able to do seated, spread out. At the time, masking was not the issue that it is today. I don't think Although when I went back and reread some of the information was there, but I don't think it had the same impact that it does today in our conversation. So we did not completely discuss, although we at that time were strongly encouraging. That was the terminology that we used. The reason why we didn't push it further is because I simply didn't have the products on hand, the PPE on hand to supply that. As you guys well know, as a school district, we have, if we were to require something or even strongly encourage something, we want to make sure that we can also supply that at the same time. So during summer school, that was simply our approach in that regard. So as we began to plan and look at the information, set up our protocols, we started looking at this fall. And there's an important piece of information here that I want you guys to understand. As we were looking through and trying to decide what we needed to do, one of the key important things that we started to say is we have to deal with the facts that are in front of us. Because as you guys well know, because you've been in your planning session, you've looked at this information, you've had these conversations, you know that it becomes a rabbit hole. And you start to, and the what ifs, and then they never stop. And then you can never move forward. So at some point you have to say, stop. What is the information in front of us? What do we have to decide just to get to the next point? And what do we have to do just to get to the next point? Because the information changes so rapidly, we felt that it was absolutely critical to start doing that. So that was what we did. So very quickly, I do want to make mention when we talk about what are the facts in front of us. I know that Alderman Flores, you asked about the question just a minute ago of Dr. Troutman, and Dr. Peak did send some current numbers, and I believe that you have been emailed on those. So I just very quickly would like to just read through some of those numbers because this is our current reality right now. Dr. Peak says, as of right now, we have 4 Christian County residents in the hospital. All 4 of them are currently on vents. Also, and then overall, since the beginning of the pandemic, we now have 14 individuals who have been hospitalized. So we've moved quite a bit since the 5. I believe it was the Tuesday evening you guys had your YouTube session. I had the opportunity to sit in and watch that. And I think at that time it was 5. Now we're up to 14. And then there have been 8 individuals over the course of time that have been on a ventilator, currently 4 are. Right now, the total number of cases overall are 395, 368 cases currently. You've got 27 probable cases. So there's 368 confirmed cases, 27 probable cases. Only 56 cases during the stay-at-home order back in March. And then since July, or saying July 2nd, we've had 339 additional cases, according to Dr. Peak. And currently, they are following 169 active cases in Christian County. Now, I believe from the Tuesday meeting that Dr. Peak had stated that they don't give information according to city, just because some of that information can be more identifiable. So I don't have any of that information, and you can read the email that she sent to us with that information. So I just basically wanted to be able to share that with you guys, because that is simply where we are sitting in our current reality as we go today. And the reason why that was important, one of the driving forces as we started looking to this fall for us in Ozark, from our school board throughout our entire organization, we wanted to make sure that we stepped back into school with a 5-day school week. We felt that was absolutely critical. We felt that was what was best for our students. We wanted to get them back in. We wanted to try to reestablish the learning. We've got a little bit that we've got to make up from last spring, clearly. So the quickest way we can get that going is maximize the time that students have with teachers. So that was our driving force. Every decision that we have made has been focused on that. And how is it that we were going to accomplish that feat, to get back in school for 5 days? So as we start planning this, things looked really good about mid-July. And then as we started getting a little further, mid-June. And as we started getting towards the end of June into July, things started, the numbers started turning around and things did not look as positive. So we had to come back and we had to revisit some of our protocols. Initially, we were strongly encouraged. Now, once again, I would go back to the reason why we were strongly encouraged is simply because we didn't have a lot of the PPE on hand, because we wanted to be able to make sure that we could supply that to students. Currently, right now, going into this school year, we have plenty. We have roughly, I think, right around 200,000 masks that are available for our 6,000 students as they do return. So we are going to be able to supply that as we go through for those who might need that. So as we went through, that is what we were looking at. We wanted to make sure that we could get into school for 5 days. That was absolutely critical that we do that. So we started having to ask ourselves, how is it that we're going to be able to obtain that task, to be able to get back in for 5 days? And so as we were looking at that, we realized we only had 5 options. So just as the doctor was talking about earlier, there's not one option that we have. We all would wish there was one, right? Here's a shot and we all go about our business similar to the flu. Now, I'm by no means a medical doctor and won't even begin to get into any of that. But the point is, we have to come back and try to mitigate our situation the best that we can. And so we go through and we look at all the recommendations, and when you look at all of that, there's 5 things that that we have landed on that we need to do in our school district to get back to school in 5 days. So I did supply you with a piece of paper there, the first piece of paper I would like for you to look at, and this is on our website. The first thing I'd like you to look at, it says face covering, mask and face coverings. This is the guidance that our school board voted on the other evening, and what our school district is now following in regard to policy. So we have 5 things that we follow that we are asking our school district to do. And the first one, number 1, is to monitor your health and protect yourself outside of school and minimize your risk of exposure, because that's one of the things that we need to be able to do. As you know, having a teacher up in front of the classroom is absolutely critical to the education of the child, obviously. But if they were to go out and do something careless in their own personal life, exposing themselves unnecessarily, then potentially we could lose that teacher in the classroom for some time if they were to contract this disease. So that's one of the main things that we stress. It's critically important that you take care of yourself. Number 2 is social distancing. It's very important. In other words, if we are more than 6 feet apart, we don't create an exposure. So the social distancing is absolutely one of our lines of defense in regard to this. So as we were looking and set our goals to how are we going to go for 5 days of school, our ability to social distance becomes absolutely critical. Well, you guys know, we were fortunate enough that our community just voted in a bond of $26 million because our facilities are full. So our ability to socially distance is really minimized. So we went through our district, classroom by classroom, and looked at 3 factors. How many students will be assigned to that room? Now, we weren't able to do that until registrations began about the middle of July. The second is, what is the furniture type? Now, I don't know if you guys know, but here recently, over the last 10 to 15 years, we really have gone to a more collaborative nature of instruction. So a lot of our classrooms have collaborative desks. There are tables, there are 2-man desks, there's 3-man desks. They're no longer individual single desks, although we have some. The majority of our furniture in our classrooms are not that way. That is not conducive to social distancing, correct? So, and then the other thing that we look at is, what is the size of the classroom? The size of our classrooms are very different from South Elementary, which is an elementary building, but originally was designed, I don't know if any of you guys know that, as a junior high. It was supposed to be converted to a junior high when it opened up in 1988, but they opened it as an elementary because that was what they needed, but then it never transitioned to a junior high. It's remained in elementary the whole time. So the size of those classrooms are actually quite nice, especially compared to our high school. Well, as you guys know, generally speaking, high school kids are usually a little bit larger than elementary kids, and the classrooms are not at the same size. And so that really makes an impact. And the other thing is, just as the doctor referenced, older kids transfer this disease at the same rate as adults. And so clearly our high school is of a concern. So as we went through and looked at this data, we came back and we said, it's absolutely critical that we put masking on the table and that we make that a requirement when social distancing is not possible. Once again, I know that you guys have heard Dr. Peake speak of the Swiss cheese analogy, where the more layers of Swiss cheese you stack on the next layer, it closes the holes in the cheese. So you then have fewer holes and fewer gaps. So we knew that we needed to be able to respond appropriately with regard to the fact that when social distancing is not an option, now we got to make sure that we have other options on the table. And masking was one of those. So we are asking and requiring that when social distancing is not possible, that face coverings are worn. Now, we did use the term face coverings because we are allowing face shields. Our students, say perhaps in choir, other areas could wear face shields that go from the forehead down. I would say that there's even guidance in the CDC that says those are not great. They're better than nothing, but those really are not great because obviously the water droplets can still come out the bottom and you can still be exposed. But we are willing to say in the work that we are doing, that'll be another piece that we'll be able to manage. And so we were willing to do that. However, we have told our staff that you can purchase we have purchased for them, and they can choose the mask to sit on the chest and go up. That obviously would restrict the falling of the water droplets as they were teaching or interacting with students. So that's why we do use the term face coverings. And then the other thing that we have talked about, our fourth line of defense, is the exposure time. So we want to look at that 15 minutes of time. So we want to make sure that we keep students moving as much as possible in the classroom setting. I mean, generally speaking, if you're talking about good instruction anyway, you match your transition to the age of the child. For example, if it's a 10-year-old child, about every 10 minutes, you want to transition to something else anyway. So in that point, we want to make sure we're breaking contact and moving around. So we're trying the best that we can to manage the classrooms as they sit. And then the last one that we have is, of course, disinfecting and hand washing. We've spent a considerable amount of money in regard to disinfecting buildings, trainings, protocols, additional purchasing of equipment. We also have put in more hand sanitizing stations throughout all of our buildings, as well as training opportunities for our kids to learn how to do hand washing. There's a whole lot of other information that is in this that I'm obviously not going to go through. You have it there for your own reference. But the main thing was so that you could understand that we have those 5 options as we went through. And this is the only way, because there's not the one solution. This is the only way that we felt as a school district we could make sure that we reached our main goal. So the piece that we have now is, as we approach, and this is really where I feel like the school and the city truly come together and really join together as partners in our process. I know that Alderman Schaefer just a minute ago had asked in regard to the willingness to wear a mask. And it wasn't that long ago, the county and the school and the city came together with other entities and launched a wearing is caring campaign, trying to encourage people to wear masks, to understand that when I wear a mask, I wear it for someone, because the mask protects others as well as protecting me. I think that is a great position. It's a great stance. I'm 100% behind it, and will continue to be behind it. The problem that we have is, as they said, that the best time to do something was the beginning of June. The second best time to do something is today, because we need to act today, because August 20th is coming. And of course, now, as you guys know, I'm speaking from the school's perspective. So I'm getting ready to bring 7,000 plus people under similar roof lines, right? So as we're doing that, those are the things that keep me up at night. So in my opinion, we need to do everything that we can to get action today. So I'm still behind the encouraging, the trying, but we need action today so that we are the safest that we can be come August 20th when we open our doors for everybody to return. To me, that's what's absolutely critical about the situation that we are in today. So as we come together, one of the things that we're going to look at now, we know that, as a matter of fact, we have had some issues already. Even though we have instituted the masking mandate or requirement for staff, so for example, if I'm in my office by myself, I can remove my mask, but if I have people come in for a meeting, we all then, of course, put our masks on as directed, because we can't socially distance. So the same thing. So we need all those 5 apply as we go through. But we've also recently had incidents in which all of our staff, as a matter of fact, our tech department has been very diligent in wearing of masks. They've actually, in all honesty, have been the leaders in our district and have been very proactive in their process. However, we had a situation come up in which a temporary worker was working, ended up coming down with COVID. They went to lunch over a few days, sitting in close proximity. Well, what do you do when you're eating? Can't eat with your mask on, you take your mask off. We hadn't even thought about that. They took their mask off, they had lunch. Now we've got a quarantine technology department because that's the steps that we have to take. So even as diligent as we felt we have been, there are still things that come up and we have to adjust to. So just today, we made a statement to the staff that says you no longer, if you cannot socially distance at lunch, you can no longer then have lunch together. You need to be able to socially distance because your mask comes off. And generally speaking, your lunch is not, well, it's teaching, so sometimes it probably is less than 15 minutes, but generally speaking, it is not that. So, the issues still continue to come up. So as we look at this, and as we go into this school year, I am sad to say, I believe school closures are in our future. We do not want that. We don't want it to happen. We are going to try to minimize those absolutely as much as possible. We have worked with Dr. Peak to go through our process, to look at the protocols, to make sure that we have everything as safe as we can make it. So if you will go to the school closure document that I gave you, once again, this is also available online. Right now, we're under current operations. You can go down through the list. I'm not going to read that list. You can do that yourself if you so desire. But those are all the things that we are putting in place and the actions that we're taking currently. As we get into school and as cases begin to come in, which obviously we hope that they do not, but it's likely that they will, when you look at the current numbers, the current reality, the amount of disease that is in our community. So when you look at that, so let's say that you have a student that then goes to, leaves our community and goes to a family reunion somewhere, they contract the disease and then they come back to the classroom and spread it to others in the classroom. It's very potential that that could happen. And in that particular case, once we get that information and we go down through the process, working with the health department, we identify potentially who the contact tracing, who needs to be quarantined, who doesn't. Potentially, we may have to shut that classroom down so that it can be properly cleaned. The health department can finish their work that they need to do and before we're able to open it back up. Or potentially, depending on the exposure, we might have to close the building down. So say, for example, if it were to happen, say, at North Elementary, we may have to close North Elementary down for the same process, trying to get on top of it. We hope that those things don't happen, but that's where when you look in the blue box on this document here, this is the things that are impacting the school district and the things that we are going to look at. But that would be an example of where it was brought in. So Alderman Chafer, like you were talking about before with the community spread piece, that would be something that would come in. But the other piece that we also have to look at is on the other side. So as we make a determination on if we close school or not, or the amount of closure that occurs is really going to be based on our community. And that's when you get into the yellow box and the red box. So my point to you today is it's just not going to be one of those things as we evaluate school closures. Do we look internal to the school, but we also have to look external to our community. So is it one of those things where we have an inability to get on top of it? So perhaps you've got many, many cases at your high school. Now all of a sudden you got multiple cases at your elementary building. So it's not that where it's being brought in, but it's invasive throughout the community that then would require our school district to close. And that is one of the things that I'm extremely worried about. And I believe that we have followed the appropriate recommendations. I think that we have done our due diligence and the work that we have done. But truly, our work begins and ends at the schoolhouse door. Once people leave that door, they now enter into our community, or they enter from our community. So we have already taken steps to, even though we have amazing parents as teacher programs, PTA organizations, we've actually restricted access to our buildings this year. We had last year an amazing program where we allowed our kindergarten parents to come in, spend time in the buildings with their child, get to know it, learn all the people that are going to be there. Our earliest learners, it was such a great time. And then this year we've suspended that program because we didn't want to have unnecessary exposure to the buildings. Our buildings have been disinfected and cleaned at a high level, so we're only wanting to bring those into the space that we control and can manage. So, but we only control up to that point. Once they leave or they come, we don't control that. So that's where I'm here today to ask you, as you review this information, as you look at it, understand the situation that we are in, and we're asking you to partner with us and to consider this masking ordinance so that our community is absolutely the safest that it can be August 20th when we open our doors to our children, in September as we continue the school year, and maybe even into October, and hopefully maybe we're getting on top of this spread of this disease by that point, and maybe it's a little bit less of concern and we can start backing off on some of these things that we have issued. But that's really the main thing that I wanted to stress here, is how I truly feel like it is an absolute partnership, and that I sincerely hope that we can come together and work through this issue together so that our schools are as safe as that they can be, as well as our community. And because as we have said many times in our Partnership of Progress meetings, that we service the same individuals. Our parents are your community members. Our children are part of our community. Our business owners also have children in our district. We are linked together. And our success at the school district is truly dependent on the decisions that you will make this evening, because that will have a tremendous impact on our ability to keep our doors open. And we find that as something absolutely critical for our children. So that being said, I will be available for questions.
Mr. Paulson. Dr. Bob and I have I think just one, hopefully. Have you read the ordinance, the draft as it is right now?
I have not had a chance to read the ordinance. I wish I would have been able to do so, but I apologize, I've not been able to.
Has a decision been made about sports yet?
As long as our school district is open, we will have sports. Yes, we have had some additional guidelines for MSHA on some processes that we'll need to implement. But as it stands right now, as long as the way that it's written in the MSHA guidelines, as long as school is in session, your secondary schools, then sports will continue. We just had a meeting today with the COC superintendents, and we're all on board to proceed with that direction. There are some limitations at different stadiums, gymnasiums, things like that, because as you well know, some other areas have different guidelines than other areas. So limitations in attendance, different things like that.
Are there any masking requirements that you would be worried of because they would cause a conflict with the process you have or something you're trying to do at the school?
Well, I think in any situation that you set up, I mean, you're obviously always assessing that situation as it arises. I think in our situation, I believe that every superintendent that was on the COC call, and I believe every COC superintendent was on the call, everybody has a masking requirement, indoors and outdoors, with the exception of maybe one school on the outdoor piece of it. As it stands right now, Ozark would have that mandate in the stadium. But we also have the social distancing piece as well to go with that. But as you all know, obviously, if we have an Ozark-Nixa football game, that's usually generally pretty highly attended. So in that case, obviously, masks would be required because you can't socially distance in the stadium, generally speaking.
Thank you, sir.
Yep.
I can't see. Who else? Galloway.
What are you doing for the next hour?
I'm ready to go.
Actually, I just have a couple questions. I'm trying to gauge the ask here. As the school superintendent or the district superintendent, you were saying that you have two concerns and they're interrelated. I'm asking to stay open and to keep employees COVID-free.
Yes.
Okay. And I think you're saying as a school district, you've done everything you know of in-house to make that happen.
Everything that we have gone through, the protocols that we have reviewed, we have those online available for people to review. Looking at the instruction, we have plans if we do happen to have to close, what does that look like? How do we prevent closures from happening? So I think that we have, but once again, as I pointed out with our tech, things may come up where we have to adjust. But we feel like we have a pretty comprehensive plan moving forward.
I think you said that you've even addressed your communal learning. Well, I don't think that's the right term, but collaborative, that's it, collaborative learning. And I guess in some classrooms, there's even PVC piping and plastic.
Yes, correct. So if you go to our website, you can see some of those that we may even have. Those photographs are actually taken kind of early on in the process, but the prototypes look a little bit better now. But yes, actually, so if you would say, take a table that would be over here by Mr. Childers, there would be a PVC pipe barricade or barrier between the two sitting there. That would, now, the CDC does say that there is not data to show that that stops the spread of the disease. But once again, we're thinking in terms of the function of a face mask, a face shield, and then a barricade. Once again, it's just another layer. So we understand that the data may not be there, but in our opinion, it made sense and we were able to implement that. The reason why we like that is once we've established our kids into cohorts, which is a little bit more in-depth conversation, there is information on the CDC guidelines on how to develop those, and there's more information on our website on how we're implementing those, the process of cohorts. But once a student then is in cohort, we are going to be able to give them some mask relief. Because obviously, as you guys know, having said there's times you got to take the mask off your face a little bit. I was appreciative when I got to come up here and speak and was able to do that. So, and so we want to make sure that we afford that to our children in the same fashion.
So you've done everything that you can think of, and then you had this comment that, but it all ends at your schoolhouse door. And so your concern is that if the city doesn't take steps themselves, we'll have defeated your efforts and you may have sick employees and closed schools. I'm asking.
I think when you look at the facts that are in front of us, the data that I read, I think it absolutely shows that that is a high probability at current. As you guys know, I don't know if you know the saying from Albert Einstein, when you do the same thing over and over again and expect a different result, that's insanity. I think that in this particular case, we have seen, even though we have launched a wearing is caring campaign, and I think there have some who have chosen to put a mask on, but it's not wide enough. It's not quick enough. We need to move faster. We need to make sure that it happens faster. And so it is my feeling that if we don't come together on this. We will still, I'm assuming, regardless of what happens here, continue to work on the push. And I don't know, and I'll be quick with this statement as quick as I can. I don't know if you guys have read much on the Spanish flu, 1918. It really is kind of an interesting thing because I'll tell you, as I was looking at this, I thought maybe I could go to 1918 because maybe somehow in 1918, maybe they had 102 years ago better wisdom than what we do today. So I went and looked, I read letters from that people wrote home to their families as they were dealing with this Spanish flu. And I thought, well, there was ordinances that went out by governments and there was, but the truth is, surprisingly, the exact same discussions occurred in 1918 as they do today. And guess what the government entities did? They launched mandates to say you need to wear masks and they worked to enforce those. But really what they really also engaged in is a high level of educating their community as to why they were important and how you needed to protect yourself and what wearing a mask was about protecting others. It was really quite surprising to me, even though I had never read those things, had never experienced that. We as a society are marching down something that happened 102 years ago, and it's almost an identical thing. But I'll tell you, one of the things that really scared me is there was a flare-up in 1918 in the fall. It came back in the winter months, and then there was a third one that was even more devastating in the spring in 1919. And that is something that I absolutely hope that we can avoid in this process. So anyway, but to me, it was very interesting. So yes, that is absolutely something that I fear, that once they leave our schoolhouse door, we lose a level of control.
So I go back to the ask. The epidemiologist from the hospital was very clear. He said, based on illness rates on other diseases last year, based on the positive rate being over 20% in testing and the increase in numbers, he was certain that they would be overwhelmed, that he was certain. And so that was a person from his industry. And then for you, in your industry, the school district, and the school district's incredibly important, not just to educate our kids, but people depend upon the school district so their kids can have daycare so they can work.
Absolutely.
I mean, livelihoods are at stake if the
Yes.
school fails.
Yes.
So that's my question. Is this necessary? Are you asking this because it's necessary for the school district?
I believe it is absolutely necessary for the success of the school year to progress at the maximum opportunity that we have. Now, we know, as was stated, there are no absolutes here. There are no guarantees. And we were fortunate that through our summer school, we had a very high, we followed all of our protocols. We cleaned at a high degree, which is what we're going to do this fall. We socially distanced. We did those things. We were fortunate, even in all of that hard work, we didn't have any cases that resulted from our summer school as we tracked. You know, we were looking at all of that, talking with the health department. So we felt fortunate. We hope that that same thing continues this fall. However, as you look at the numbers, the current reality in front of us, the numbers don't necessarily support that unless we take action. So I absolutely believe that if the city comes alongside with us and we with the city, that we absolutely can help each other be successful as we move forward.
Okay, and I just want to make sure I understand, because I think I heard the term high probability of problems for the school district if we don't enact this. I guess that's I'm not sure that I don't want to put words in your mouth.
Well, I'm not a statistician, but obviously I would say when you look at the numbers that are in front of us, yes, I think there's a high probability that that would happen.
And so I guess that's my question. So you need us to pass this based on that? I'm asking.
I am asking you to pass that based on that information. I believe it is absolutely critical for us to come together on this issue for the health and the safety of our children.
All right, thank you, Doctor.
Other Alderman questions? Mr. Schaefer.
Dr. Bowman, just so we can be clear, do you have a number of how many fewer sick people there will be if we enact the mask ordinance?
Do I have a number? If I could get the crystal ball that we had talked about earlier, that would be great. I wish I did have that.
I mean, we're talking about an issue in this community that's equally divided. Alderman Galloway did a fine job of getting you to say that if we don't pass this ordinance, schools will close. So I just want the community to be sure, because Dr. Trotman couldn't tell me the rate of infection or how many fewer sick people we're going to have. I think we all can concede that masks help, but I just want to be clear that you're not saying that you know how much the mask is going to help, nor does Dr. Trotman know how much the mask is going to help, right?
I would actually disagree with that, Alderman Schaefer. I think that you can say that the masks are going to help. There is evidence to show.
I am saying the masks are going to help. I'm asking about, we don't know to what degree it will help, correct?
Well, to me, if we help anything, if you go back and look at our school district, we look at each child as being important. So to me, if we do this and it stops one, now we would most likely not know the one, obviously. But my point is, I think absolutely it would be important enough for us to do that.
And that's what my point is as well, is that I'm hearing a lot of people say, if we can save one person, or if we can have one less person in the hospital, that I should vote for an ordinance that's going to restrict the rights of 25,000 people. That's what I hear. If it only takes one person, that can benefit the life of one person, that I should impose fines on the citizens of Ozark who choose not to wear masks. All right. And I say, well, with the flu, we can help one person with masks. So if it's just one person, it's going to open up a Pandora's box of all types of ordinances that we could pass. As an alderman, I view our rights, we have great power. And with great power comes great responsibility. And because of that, I want to know more about the facts of what the results are going to be from my mandate. How many people we're going to save. How many people fewer people are going to get sick, okay?
Sure.
And I know those are hard questions. And that's why I wrestle with it so greatly.
Yeah.
Because they're not simple answers in this chaotic time.
I would agree with that.
Thank you.
I think that as we do process and look at this, I think it is really one of those issues where I think it takes action, and then you look back at the result. And you know what? Maybe it would be one of those things where we come back and say, maybe those were steps taken too far, and we reevaluate. I think if you look at the decisions that you made in March to decide what we were going to close down and what we weren't going to close down, who was going to be essential and who wasn't going to be essential, I would say you probably learned something from that, didn't you, in that process? And I think this also will tell us some information that we will need to know. To me, this is a measured, calculated step that we can take that will help us continue to operate at the level that I think all of us want us to be able to operate. I want us to be able to be back in school. And if we can follow those 5 options, and one of the things that I've stressed at the school district is masking is one of the options. Our preferred option is to socially distance, to get outside. We've encouraged our teachers, we've bought equipment so that they can go outside and teach outside. So to me, masking is just one of those pieces of the puzzle. So I think probably at the end of all of this, to your point, if we go through, I think it's absolutely critical that we come back and reevaluate and say, here was the data points, here were the decisions that we made, and this is why we made those decisions, so that now the next time, as your concerns were, we can come back and we can say, now we had data, and this is what made sense, and the actions that we took and the result of those actions. Because I know that the steps that we took in March, we look very different. I mean, potentially the actions that we took in March, maybe the actions that we need to be taking today, and the actions we're debating today should have been the actions we had taken in March. It would have been great, right? Hindsight is 2020. I wish that we could be able to do those things. But I think in this particular point, what we're saying is we don't want to shut our businesses down. We don't want to close our schools down so that now our parents are saying, what do I do with my kids? Because we do provide childcare so that our parents can go to work. And we want that role. We want that job. That is a part of what it is that we do. And we're excited to do that every day. So I do think that it's important for us, to your point, to go back and absolutely reevaluate. I don't think you should ever make a decision, especially as difficult as this, and then just move on. I think we always need to reflect back and make sure that we improve our decisions later on as we learn from potentially mistakes, mishaps, or even successes. And I believe in this case, my opinion is it'll be a success, but the data will tell us.
Thank you, Dr.
All right, any other questions of Dr. Bauman? Thank you very much.
Once again, I thank you.
Thank you. We need to take a break. Yeah. We will take a short break, probably 5 minutes or less if possible. So the bathrooms are right over here, and we will reconvene here shortly.
Patience. The next order of business is public, people that are coming from the public to speak. And the process is that as you were coming in, everybody was offered a card to fill out if you wanted to speak. And so they have been put in a box, and Chandra is going to, well, and Sam, where are the speakers that are coming next? Okay,
We're gonna have to call them up.
okay,
I think a lot of them might be in.
all right. If your name is called, would you please come and sit, and we'll just go from left to right when everybody that is seated in the front row has already spoken. If you have a seat in the back, you can go back. Otherwise, you can go to the, okay, Sam. And the 6:30 was the deadline for taking cards, so we will take no more cards. Okay, Michael Barnett. Thank you, Michael.
And do you wanna call them all up?
Yeah.
Call all these up so they'll sit in the front row.
Yes. Oh, and then, yeah, and if you all would sit in the front row. Luke Davis, Siggy Hill, Heather Davis, Thomas McInish, or McInish, John Cockcroft. Okay, now I know some of the names, but I'm not gonna know them all, so, if you start with you, sir. And there's a 3-minute limit. The timer is over here, and with the signer, is there another timer that, or is that the only one? Okay.
That is the timer.
Okay.
You got the thing to
That,
vote.
okay. All righty. Speak, sir.
I am not anti-mask. I am not.
Loud, please.
I am not anti-mask. I am not arguing the science behind the mask. I am not arguing that masks do not work. If someone makes the decision for themselves to wear a mask, good for them. If a business decides to enforce their own masking policies, good for them. I, nor anyone else, has to agree with that person's choice or that business's choice. But it is in each individual's own choice, and it is an individual choice. No one should be forcing another person to wear a mask. No one should be forcing businesses to force their customers to wear masks. I am saying no to any proposed masking enforcement. Strongly suggest the wearing of a mask if you must, but do not force it. More government is not the answer to this problem. More government will be the problem. I thank you all for listening.
Thank you very much. Mr. Davis.
Do I get the rest of this time?
No, sir, you do not. Unless you brought something to eat.
Well, we can arrange
No,
that.
kidding.
First of all, thank you all. I know it's a difficult decision. As elected official myself, I know how this can be. I've never had to deal with an issue quite like this, but I totally understand where you're coming from. There's been a lot of debate on a lot of these facts this morning or this afternoon, but there's one fact that hasn't been mentioned yet. Even with the latest data from the health department from Christian County, we're looking at 0.2%. 0.2% of the people in Christian County have been affected, actively affected right now, 0.2%. And to Alderman Schaefer's point earlier in this meeting, we're talking about passing an ordinance, a mandated ordinance, to where I become a police officer in my own business if people want to come in without a mask. And I challenge you all on that. I do not think that's right. I definitely think it's up to the business. As a business owner here in Ozark, we have the right to decide for ourselves if we want our patrons, our customers coming and wearing masks, or if we want our server staff to wear masks. That's what it's about. That's what it should be. It should be up to the individual business. And as many of you know, I don't know all of you, but I know of most of you. There are several businesses already in the city that have already took it upon themselves to get and to post mask required. And that should be up to them individually. And if you don't want to wear a mask, or if you don't want to come to my business because I'm not wearing a mask, that is your right too. And I think that's what you're going to hear a lot of tonight. I certainly didn't mean to be the second speaker, but I'm glad that I am, because you get to hear a lot of this from me first, and it's not a lot of regurgitation, but I think you're going to hear a lot of that tonight. You know, there were 2 surveys, my understanding was, about the ordinance and about the mandate, the way that it's written, that I don't understand why that was not shared here this morning or this afternoon. Because if I understand the results of those two surveys, just for Ozark, not speaking of the one in Nixa that was not for it, the two surveys in Ozark were not for it either. The public that participated in those surveys were not for the mask mandate. Like I said, you're going to see a lot of people, such as myself, that are going to make the decision for themselves on whether or not that they should wear a mask or ask their customers to wear a mask. And then finally, the way this ordinance is written, which I still need clarity of. I asked for it earlier. I kind of got it. It looks as though, as a business owner, my wife and I have a business here in Ozark. We become the people that have to tell someone to leave because they're either not wearing a mask or they refuse to wear a mask, or we're subject and liable to penalties and fines based on the way this ordinance is written. I need to spend my time worrying about how I'm going to get more staff, how to watch food costs, how to make sure my bartender isn't pouring more than 5 ounces of wine when you come in. That's what I need to spend my time doing. I don't have time, and my staff doesn't have time to worry about and to manage the process of whether or not people coming into my business are wearing masks. So I'd ask you to please do not support this mandate. Please vote against it. Thank you.
Thank you. Let me clarify something, Ms. Davis, before you come up, because you mentioned the surveys and you mentioned the ordinance. I want to read to you. This is just what we're considering tonight. It doesn't mean it couldn't be changed in the future, but it says that no person shall be in violation of this subsection if such person or the place the person owns, manages, operates, or otherwise controls requires compliance with the provisions of this ordinance to wear a face mask covering, and the patron or customer refuses to wear a safe covering. So I think that should answer your question, is that you would not be responsible if you make an attempt to enforce it and they do not, then you cannot. That's the way I read this. Is that correct, Ms. Galloway? Yes, ma'am.
Do they have to leave?
That's up to you.
So I can allow them to stay in violation and I don't get in trouble.
No.
No.
So I do have to enforce it, or I'm subject to penalty.
Yes.
Yes.
Because that's where D comes in.
That was my point.
Violation of this, D is violation of this ordinance are hereby declared to be opposed. Yeah.
Yeah.
Yeah. Well, we all know this is been a very long discussion with the police department on more than one occasion, that they are our enforcement agency, and this is going to be very difficult, if not impossible, to enforce. So that is not telling you that there won't be attempts. I don't know. But and then I want to, before you come, Ms. Davis, I want to tell you about the two surveys. You asked about that. I've got the information right here, and I don't have any problem sharing that with you. The city did a survey. I think there were something over 5,000 responses to our public information officer did that. It was an online survey wanting to know how people thought about it. And it was a 1, 2, 3, 4, 5, strongly disagree, neutral, strong, agree, and strongly agree. So, and I just have the Cliff Notes version here, okay? But there were 53% of that said they do not want a mask ordinance, and 47% that said they did want a mask ordinance. Now that is of the total number of respondents. There were 71 votes that came in from one IP address. Okay, you can expect that to happen. I don't know what that does to the numbers, but bottom line is it wasn't a clear-cut mandate, but it was definitely a majority in favor of not having one. Okay, you can determine for yourselves how clear-cut that was. Okay, that was to anybody that wanted to respond to the city's survey. That was not limited. There were no limitations. If you could get online and take the survey, you could answer it. So the Chamber of Commerce also took a survey, and they did it to their business members only. And there were 124 people that responded, and there was an indoor-outdoor version of this. And you all will appreciate this because you have your businesses both. Of the indoor version only, 47% of the people wanted a face mask ordinance and 45% did not. So there was a 2% in favor of wanting one. For indoor and outdoor, it was much different because there were many more people that felt it wasn't necessary outdoor. So it was 34% wanted it if it was both, and 56% that did not want it if it was both. So you interpret that as you want. There was one interesting question on that survey. Don't know if you've seen it, Mr. Davis, but it was just a very clear-cut question. It said, do you feel if there is a mandated ordinance that it will affect your business? I didn't, the chamber came up with this. The city had absolutely nothing to do with it. I'm just repeating to you what the numbers are, and I've got copies of the survey here. Like I said, these are the cliff notes. There were 52.5% of the people that, business owners, that felt it would not impact their business. So I'm just giving you that for information, only because you mentioned it. So I don't, you know, I'm not taking an opinion on it. So Ms. Davis, it's your turn.
Thank you all for coming together here with us today. We all get to kind of make this decision together. I just want to let you know, first and foremost, I got to listen to your 2.5-hour discussion, and it really shed some light. I appreciate where all of your hearts are coming from, and I think you all are committed to making this decision, and I appreciate that. And I've been praying for you guys all week because I know this is an incredibly hard decision that you are faced with. So a couple of things that I wanted to address. First of all, I'm with the Vineyard Market here at Ozark. I happen to be the business that you all mentioned in that 2.5-hour segment that I wanted to keep the rights with our people and the rights with our citizenry. And if they wanted to come in and felt comfortable to not wear a mask, I didn't want to be in the position to have to tell them that. So I was that business. I'll take claim to that, so there won't be any question to that. I wanted to talk with you. I'm not here to debate the issue of the mask mandate or the effectiveness of the mask, if you will. I think there's a lot of valid information on both sides of the equation that we could probably argue all night just on the effectiveness. That's not what I want to talk to you about. I want to talk to you about my personal rights as a woman, and I want to talk to you about the rights of all of our businesses and our citizens. So long before I was born, Roe v. Wade said that I have the right to do whatever I want with my body, up into including taking the life of a human being that God happened to bless me with in my womb. I have the right to do that. That is most certainly a public health risk. Somebody will die in that situation if I were to so choose to do that. So maybe even two if things don't go according to plan. You guys are asking me to do something with my face that the Supreme Court already ruled a long time ago. They have no jurisdiction over my entire body, and I have a really hard time sitting here having this logical conversation with you that you all think you have jurisdiction over my face. You don't. Secondly, let me just catch you up what we've been doing. So I feel like this point has been somewhat moot. I feel like the business leaders in this community have stepped up to the challenge. Most of them have. Lowe's, I can't buy 2x4s without putting a mask on. I can't buy toilet paper from Walmart without putting a mask on. My bank, getting my nails done, seeing my doctor, getting my hair done, all of those things, those businesses have reached out. Let me let you know what we're doing at the Vineyard. We have a capacity of 100 guests indoor. What we did is we stayed at half capacity. You guys recommended in the beginning that we should run at half capacity. We have stayed there. So what we did is we partnered with Mr. Childers, who was awesome. You have an awesome individual right there. We came together and we solved the problem. I needed to have more seating so I could keep my doors open. And Mr. Childers and I worked together and we put a patio outside. We threw up a makeshift patio in the parking lot, which is the cheesiest thing ever, but it is safe. That's what we've done. And so I feel like as business leaders, we're taking care of some of these things on our own. And I don't feel as though we need to have a mandate in play. The other thing I'd like to mention is you guys rocked with the
Heather, I'm
amount of
sorry.
time.
You are.
Amount
I
of time.
apologize.
That's okay.
Thank you.
I just wanted to compliment you. You guys rocked with the Educate, Not Mandate initiative. That was brilliant. The entire
Thank you,
county
ma'am.
came together for a common good, and it's working.
Thank you. Yes, sir.
Thank you for the time this evening. We were told 2 weeks to flatten the curve, slow infection, allow hospitals to prepare space, acquire PPE, and not overwhelm the healthcare system. The goal was clearly defined. That was approximately 147 days ago. In that time, the government removed the goalpost to flatten the curve and replaced it with the unobtainable goal of stopping all spread of a virus and halting all death from it. Members of this community were arbitrarily divided into essential and non-essential. Healthy people quarantined. Schools, businesses, and houses of worship were ordered closed. and citizens told to surrender whatever is asked, including their ability to provide for themselves and families in the pursuit of the impossible. No choice was given, no vote taken, no due process followed. Well, we learn more about the virus every day. The microbiology of a small virus small enough to penetrate non-professional masks is the same. The fact that non-professional masks worn by untrained people run the risk of counterproductive cross-contamination that can harm wearer and others alike remains unchanged. Tonight, this board is proposing a mask mandate that has no quantifiable goal, no end in sight save for an arbitrary date that can be extended indefinitely. They're willing to fine members of this community and businesses for no other crime than daring to disagree with them. There is no enforcement mechanism because they believe that should be done by the citizens and businesses, intimidating, threatening, and bullying others into compliance, creating a dangerous situation in our community. To suggest that individuals be forced into something so personal as covering their faces indefinitely under the guise of protecting other people is a huge, dramatic change in the relationship between the government and the citizen. We should not allow any executive authority to unilaterally decree it. Doesn't the near universal opposition to widespread mask wearing from experts before the issue became political hold any weight? Doesn't the reversal demand explanation? Decisions are being driven by personal biases and possibly mercenary motives, and not in the best interest of our community. Most of the community disagrees with the mask mandate, yet Mayor Gardner states, "It's my intention to bring forth an ordinance or a mask mandate." And Alderman Galloway, there is no good reason not to vote for this ordinance, and there is really nothing to this decision. Credit Headliner News. We were told just to wear the mask. This is not science, ordered liberty, or constitutional governance. It is what they do in North Korea. We are no longer 24 hours into an emergency. We're over 4 months into the virus, and it's time to function like the representative republic that we are. We are citizens, not subjects. C.S. Lewis speaks to our situation eloquently. Of all tyrannies, a tyranny sincerely exercised for the good of its victims may be the most oppressive. The only reasonable decision tonight is to vote against a mask mandate. Thank you.
Thank you.
Thank you, Mayor Gardner and City Alderman. My name's John Cockcroft. I was a newspaper editor here before the internet when people read the old paper with ink on their fingers. I really appreciate all of you taking time to consider the options, but there's been talk that some of you have made up your minds in advance, and I don't like to hear that. Whether it's true or not, I don't have any way of knowing, only you know. I do know this. I took my own specific time to contact each and every one of you via a voice message, and 4 aldermen replied, which I am very thankful for. So thank you to the 4 that did reply, and thank you to the others who didn't reply for actually realizing and underscoring the idea that I have inside my little head that some of you have already made up your minds to go in favor of a mask mandate. Now, I don't know if that's true, but it feels that way. Putting masks on everybody here tonight feels that way. It's a very awkward thing. I know the timer's not running, so I'll be brief. I get that I don't have 2 minutes and 59 seconds remaining, but even if I did, I wouldn't take it. I want you to know that thank you for taking the time to weigh this issue without making up your minds until you've heard from the people. I took a funny little survey on Facebook. 61 said no mandate, 1 said yes mandate because they knew somebody they had lost due to COVID. We can't prevent that with a mask. Thank you, guys. Have a good evening.
Thank you, Mr. Cockcroft. See, we called your name and you weren't here, but your name was called, so please feel free to come forward.
I had to bring my husband home so that he could go to work.
That's okay.
All right, so what do I need to do?
Well, you've got 3 minutes to speak and the clock is ticking over here.
Okay, my name is Siki Hill. I'm a resident and business owner here in Ozark. and I'm against the mask for several reasons. First of all, I want to know the data that was mentioned tonight. Where are the audits that these data are correct? We have too many information from the communities and also nationwide. The data has been corrupted and that people have been tested 15 times or multiple times or not even tested and had positive results. So I request from our aldermen and from our city council that you audit all the data before you make any decisions. And another point I want to bring up here, I see that you have two experts here, or one expert actually only, Dr. Trotman. And where is the expert of the opposite side?
You asked me that earlier, and I said there were not. These are the two people that have a stake in the decision that's made from our healthcare industry and from our school district, which has 6,000. Hang on, I'll let you speak. And so we asked them to come. And if there was anybody in that school district or in that, you can add minutes or add seconds for the time I'm taking. But if there were people in the school district who we wanted to come or in the hospital area that wanted to speak against it, they could have. So proceed.
In my eyes, this is not a fair meeting because you're not providing the proper information. If that's what you want to achieve with this meeting, you wanted to bring experts in that talk for the map, and you're not bringing anybody.
Mrs. Hill is speaking.
So on the other hand, I have become aware that the city of Springfield received $2.1 million from the CDC or government organization for the MAPS mandate. What is Ozark getting?
To my knowledge, nothing. Christian County got 10.3 million, and that's being applied for. That's not something that we have the answers to. You'd have to check with the county commission.
Okay. Another thing is you heard Dr. Trotman talking about remdesivir and other remedies, obviously, that they are using in the hospital. I haven't heard anything about hydroxychloroquine. Why is that? So have you not educated yourself about hydroxychloroquine? Then I'm very disappointed that you're not bringing my questions up that I sent to you by email. And hydroxychloroquine is a relevant therapeutic for the disease, for people not to get sick or not to even die. And there is hundreds and thousands of tests available from all over the world, and also the United States. Hundreds of doctors that have used it successfully. Why is Springfield not using it? Why are we not recommending it and using alternatives like that instead of enforcing a mask mandate? Another question is, what do you want to achieve with that mask? When the virus itself is so minute that there is no mask, unless it is a medicinal N95 that would protect us actually from the virus. So you're telling me that this mask is nothing else worse than a chicken wire to protect yourself from mosquitoes. Correct? Have you thought of that? And if you haven't, next question is, what are you doing with these masks? If they are that protective to protect us from hazardous breathing and droplets and what have you all, and viruses, then this pertains to be a hazardous material. Where is the hazardous waste? I see masks on the streets and on the parking lots. So we are only creating more waste on the streets.
I don't know how much time I took of yours, but the
Okay,
clock's
I'm
not
done.
running.
That's it. Those are my points.
Okay, thank you very much, Michelle. All right, I'm going to call out names, and if you would please come and sit. Chuck Abrahamson, Michael Autry, Paige Bauman, Amanda Hedgepeth, and Mary Adams. Mr. Abrahamson, good to see you, sir. It's been a while.
It's good to take that off. I've got a little lung problem. I can't work in that long. Do I know about coronavirus? I do. 3 months ago, I had a granddaughter, 19 years old, in the hospital in Minneapolis Wood for 9 days. 2 weeks later, the woman I'm married to for 55 years, who was 77 years old, came down with coronavirus. I know what it's like to sit and wonder and cry. and not be able to communicate. On the other hand, I also know that she survived it because she was able to get medications that we heard our doctor say earlier tonight we no longer can get. That's not the issue. The issue tonight here is wearing a mask. Do I fear coronavirus? Absolutely not. Only 0.2% of the people succumb to coronavirus. That's a pretty good success rate. More have died from heart attacks, from strokes, from diabetes, from other issues, because they couldn't get treated, because our medical people and our people in government acted like a bunch of sheep. I come in tonight and I know there's been a predetermination on this issue. Why? Because I see everybody that's wearing a mask. I see who fears coronavirus. And if the city was serious about getting some honest figures, I haven't seen one sign on any boulevard, on any street, any place in Ozark that talks about this meeting tonight. Our mayor talked earlier about the studies that we have taken. They were on the internet. 98% of your taxpayers knew nothing about it. I knew nothing about it until I heard it tonight. So do I think people have the right to wear masks? Certainly. Should they wear a mask if they fear it? Absolutely. But I do not think people have the right to shove it down my throat if I don't want to wear a mask. The World Health Organization today put it out a post. You don't need to wear a mask if you're healthy, unless you're working with people that have an illness. And you can 6 feet social distance. We heard that in our school. If they can 6 feet social distance, we're going to go ahead with some of our activities. So wear a mask if you want to, but don't force it down on other people. Thank you.
You ladies doing the signing, if you could move back just a bit so I can see the clock. Thank you very much. Mr. Autry.
Hey guys. Well, I know you guys have been under a lot of pressure to get this thing figured out. We've been dealt, we got a fair running loose amongst us and we had to figure out what to do with it. But I don't see where this mandate is going to get us where we need to get. People aren't, we've got people that work in stores and they're not piling up out here, and they've been convenience stores. They get 300 or 400 people a day and they're not getting sick. They're not dying out. The homeless people aren't dying out. Like I said, it's like 0.02, 0.03% mortality rate now that we've reached. And I don't see the reason for me having to wear a mask. If you want to wear a mask, they pretty much said about what I wanted to say earlier, but it's like, if you want to wear a mask, I'm okay with that. I'm not going to make fun of you. I'm not going to mock you or anything else like that, but why should I have to wear it? And then the doctor was talking about, or the superintendent was talking about, starting school back. I think it's a waste of time for them to put all this into it because people are going to come down with it, and then all of a sudden everybody's going to want to send the kids home and da-da-da. So, I really think they're kind of peeing in the wind on that deal because they'll shut it down just mighty quick, when this all starts. So we're just making it, I'd say let's put these efforts towards something else besides going on a failing mission, and that's what I think they're doing with these schools. I don't think you can contain this. I think we need to fight it, We can't hide in the cave. We got to get out. That bear's out here. We need to get him, okay? We can't run from it. I'm not scared of getting it. And, it's just, there's treatments for it besides the people dying are the ones going to the hospital, okay? The people getting treated by the right doctors are not dying. They've got pretty close to 100% success rate, a bunch of them. And so, I don't see where this is going to help us out. And I think it's overreach. I really do. Tell me to wear a mask around. I feel so silly and I can't see through this thing. And then that other thing, none of y'all, it just doesn't fit, The government shouldn't be telling us to do this. We don't have, the numbers aren't there, okay? The numbers aren't there. People aren't piled up like cordwood. The homeless should be stacked up out here in dead piles. The store clerks should be stacked up out here. They deal with people all day. They're not. I visit with them. Now I can't socialize most of the time because everybody's wearing masks. It's like, I forgot what you look like, It's like, this is nuts, and we don't have an end game on it because everything's, it's nothing solid that, where we're gonna end this, because it's not. Anyway, that's all I got to say. Thanks.
Thank you. Thank you very much. Yes, ma'am.
First of all, I'd like to thank Mayor Gardner and the City Council for allowing me the opportunity to speak today. I'm Paige Bauman, and I'm a student at Ozark High School. I'm sure you'll hear from plenty of people today that have very strong beliefs on masks. Maybe their thoughts reinforce your beliefs, or maybe they contradict them. Nevertheless, my beliefs aren't based on politics, the economy, or whatever I think my constitutional rights are. In my opinion, wearing a mask is not a matter of any of these things. This is because I believe that no matter your stance on politics, the economy, or your interpretation of the Constitution, you can have compassion. I'm 17 and obviously not at a high risk. And as our governor says, we have to get back to school, and we will in fact take COVID, but we'll not have to sit in doctor's offices, and we'll just go home. I'm not naive to the fact that our economy has taken a massive hit as a result of COVID. Although, in going back to school without masks, and frankly in going anywhere without masks, there are great risks of outbreaks. And even though I would most likely survive COVID-19, that does not mean the people I go home to will. My mother has stage 4 metastatic breast cancer, and because of chemotherapy and radiation, she's at a very high risk. It's hard for me to accept her diagnosis, so the last thing that I want is for my time with her to be shortened even more. I also go home to my grandparents who are 82 and 96. I cannot just think about myself in the midst of this virus. I also encourage everyone else around me to think the same. Furthermore, this next year will be the start of my senior year, the year I've been waiting for as long as I can remember. Since my freshman year, I wanted to be captain of the Color Guard, and now I finally am. But my competitive marching band season was just canceled. I fear that the rest of my senior year will look the same. As I'm sure everyone else feels, I just wanted this all to be over. I want normalcy back in my life, and I want to have the senior year I always imagined. I believe that masking is the first step in getting things back to normal, and with your votes, we can come together as a community to achieve this. We're better together, and a masking mandate helps us all be safer together. All that I truly ask is that you have compassion for the citizens of this community, and that your decision, whatever it may be, reflect this. Thank you for your time.
Thank you. Ms. Hedgebeck.
Good evening. I'm Amanda Hedgepeth. I am also the Vice President of Hospital Operations at Cox Health in Springfield. I'm also acting as our Deputy Incident Commander for our COVID-19 response for the last 5 months. I come to you today asking for a vote yes on face coverings. I also come to you today as a lifelong citizen of Ozark. My 3 kids are all school-aged and all will be attending school in the coming weeks. I'm grateful for Ozark School District's stance on masking and feel safer sending my kids and many other kids to school. I'm hoping the city will follow suit and protect our community, including teachers and students, as Dr. Bauman said, when they're out in the community. We don't want them to bring it back when they're back in the school district. When we look at other states, New York is sending their kids back to school this week with less than 1% positivity rate. Again, we are currently sitting at close to 20% positivity rate in this area of the country. Masking is proven to slow the spread of the virus. It's not about cleaning. It's not about contact surface. Our evolution has changed. Our knowledge has changed on this virus, and we have to continue to keep up with that knowledge changing. It's about physical distancing when we can, but we know there's no guarantee of physical distancing with kids and in busy stores and other busy places here in Ozark. It is about wearing a mask when one can't guarantee physical distancing. Some may say masking doesn't work. Again, continue to look at the case study of Great Clips here in our own backyard with over 140 potential cases of 2 positive hairdressers with 0% transmission. Many think COVID patients are from other areas of our service area in our hospital. This is simply not true. 80% of our cases right now in the hospital are 44 patients at Cox South. 80% of them are from 5 counties around us: Greene, Christian, Stone, Taney, and Berry. These are not counties from outside our area. These are our own people in our own backyards. Christian County had 56 cases on July 1st. Now we have 395 cases, 21 positives just this weekend. The health department, our Christian County Health Department, is stretched thin and cannot keep up with all the tracing. Support is needed for them, and your voice and your vote is the support they need. We can look at economic impact. I'm a local person. I want our businesses to do well locally. I will follow all rules that are already in place. that other people we've conditioned not to balk at. I will drive the speed limit, I will wear my shoes, and I will wear my socks when I go into a restaurant. I will wear my shirt. Masking could be no different than for us. This is not political, it's simply about protecting each other. This is about bridging us until there's a vaccine or more therapeutics or other avenues. This is about ensuring our health department and our hospitals do not become overrun. This is about helping our teachers and students when they're in the community. And this is about our business and the ability to protect the economy of Ozark. Thank you.
Ms. Adams?
Your Honor, Alderman, I'm Mary Adams. I have a business here.
Could you come closer, please, to the speaker or to the microphone?
Okay, can you hear me now? If not, I will remove my.
Can you hear in the back?
Can you hear me?
No. It's all right to remove your mask here.
All right.
Just,
as a business person, you are all welcome to my business with or without a mask right now, all of you. I will assure you of one thing, I will have my mask on to protect you. I have my mask on to protect you. Now, what do I do about protection for me? That's up to you right now. I am not going to try to educate everyone who comes into my business. I don't have time, and frankly, I don't want to run my business off by education. For the first 2 months when this pandemic came around, I stayed home. I'm a high risk. Well, after about 8 weeks, I got sick of that because I'm a social person. I wanted to travel. I wanted to go places. I wanted to do business here in our community. I was so happy when Walmart decided to mandate masks. I could go again. It was wonderful. As far as our traveling and other businesses here in town, when we travel, we go to places that require masks. When I walk into a restaurant and the service people don't have masks on, I've walked out. It's just not worth it to me that they don't care enough about their business and about me to wear a mask that may and has been proven to stop a pandemic. Personally, I have a 50-year-old niece, not in Missouri, who was tested on March the 6th for COVID-19. It came out negative. 4 weeks later, she came down with pulmonary edema. It went into pneumonia, encephalitis, and now she has encephalopathy. Her speech is slowed, she stutters, she cannot drive a car, and she is a nurse practitioner. She cannot go to her office. She cannot do the things that she wanted to do. Her horse was her life, I'm afraid, and she can't do that. All she can do is depend on her mother to bring her food and take her to the doctor. She will be applying for assistance. I put my seatbelt on. My son put rear view mirrors on the side of my Jeep because I didn't know it was a law you had to have them, and I just thought it was a big inconvenience. And today I've got those. So I meet requirements that are required.
very good.
Thank you.
Thank you very much. Okay, John Mitchell and Samantha Gammon. Ghana. Okay. We'll start over here on my right.
Roy,
Okay, thank you.
February 29th, Surgeon General Jerome Adams tells people masks are not effective against COVID. March 8th, Dr. Fauci says no need to wear masks. Now we know that they've changed. They changed their minds. Fauci changed his mind 4 times in 4 months. We don't really know yet, but you know. But now he comes out the other day and says he doesn't regret telling people not to wear masks because there wasn't going to be enough masks. Well, there's all kinds of masks. You can even put your shirt up. That's okay now.
but he was scared that N95s were gonna go out where no one could get them. In 1918, the pandemic, they did studies. People wore masks back then. They did studies on it. It didn't stop anything because people didn't do nothing else to help stop it. They didn't wash their hands. They didn't do anything. I see people now, they're wearing masks. Lady the other day comes out of Walmart, takes her mask off and starts coughing like crazy. People are going into places with symptoms because they think a mask is going to stop it. A mask will slow down the distance. It is not stopping it at all. Even the CDC, they don't know. You can get it on surfaces, can't get it on surfaces. People touch this all night tonight. It doesn't even make sense to me. The pandemic rate, the mortality rate in 1918 was 0.1%. In 2009, H1N1 pandemic mortality rate was 0.5%. 2020 COVID rate right now is 0.04%. We're not even close. Those are numbers on the CDC that I just got up. Christian County numbers. Since March 17, 14 individuals have been hospitalized. 4 are currently in the hospital on a ventilator out of 395 cases in the whole county. 1 deceased. I called the other day, Christian County Health Department the other day. They don't have no idea how many people died of the flu this past winter. We don't wear masks for that. We never have. We didn't wear masks for H1N1. We didn't wear masks for SARS. I don't see the reason to force people to wear masks today. That's it.
Thank you.
Thank you so much for your service and this opportunity to speak. My name is Suzanne McGowan, and I am in my 14th year as a band director in Ozark Public Schools. I do support a mask mandate. I love my work. I care deeply about our students' needs and desires to be in person in school for the entire school year. We do know that masks reduce the transmission of this virus. If we can slow the transmission now, we will be better equipped as teachers to educate our students in person all year long. We also know that as school begins, it is likely that cases will increase. As more and more faculty and staff and students are exposed, the result will be quarantines of our small group cohorts, quarantines of classrooms, potentially entire schools, or even the entire district. This is not what is best for our students. Our students need continuity. Alderman Schaefer, I believe earlier when Dr. Baumann was speaking, that you asked him how many people this measure will save, and my answer to that is what is the number of our student body at Ozark Public Schools? That is the number of students that this will save, because we are saving their education, and that is why I'm here tonight. It is not just about how many deaths or how many hospitalizations we have. We need to look at the bigger picture, and I am asking you all to pass a mask mandate this evening. While most people are likely to recover, some likely will not. I do wish to protect my immunocompromised students and colleagues. Please set us up for success as teachers and as students. I ask that you pass a mask ordinance today to help our students and our staff stay safely in school for the entire year. I think if I asked people to raise their hand, if you agreed that students need to be in school, we probably would all raise our hands. We need to do this safely. We need to ensure that they are able to be educated for the entire year in person if they choose that is best for them. So I thank you for your service, and again, thank you for this opportunity to speak, And if it is ever safe again to hold an in-person concert at the school, you're all invited. Thank you.
Yes, ma'am.
I am Laura Tacky, and I'm also a teacher in the Ozark School District. I'm here in support of a citywide mask mandate. I attended your July press conference in support of masking for a friend campaign. I shared and I participated in efforts to promote masks. However, the campaign has not been effective in keeping the virus numbers down. I'm proud of my district and their response to masking, but in order for this to be truly effective, we need community support. We need city leaders to step up and make a right decision for our community. Last week, Steve Edward posted on Twitter that the common threshold to enact public health measures is a 5% systematic positive rate. The latest data shows Ozark is at 20. Even a small number of positive COVID cases will close our school buildings for a short period of time, but the damage will already be done to our community. There will be lifelong debilitating conditions and deaths as a result of this spread, and it should not be because of an inadequate protection and community readiness. This is a serious health crisis, and decisions should be made based on scientific data only. It is proven that masks slow the spread, and this pandemic places a responsibility on each and every one of us to do what we can to slow the spread of COVID-19. It simply requires us to follow the advice of experts and stand up to those who put our health at risk and also the health of our community at risk. I'm here because I want to be back in school with my students, but I want to be able to do it safely. Please listen to the health professionals and pay attention to the increasing numbers. Wearing a mask is such a simple act that could protect our community, my students, and our staff. Thank you.
Thank you. Yes, ma'am.
My name is Beth Eggleston. I appreciate the opportunity I have to speak with you tonight. I live in Ozark. I have 2 students who go to Ozark Elementary Schools, and I am a teacher in Christian County. I teach over at Nixa. Because I live in Ozark, we moved here 5 years ago because of the schools. That's why. It was while I was still working in Springfield, and we wanted something better, and so that's why we came here. I'm grateful that the school system has decided that masks are mandatory. It makes me feel better as an educator, and it makes me feel better as a parent to know that my students, my children are going to be safe, and their teachers are going to be safe. It makes me feel better that they won't get infected and maybe unknowingly bring that virus to my mother, who is on oxygen and who would probably die from COVID-19. And so it makes me feel good that they've got our best interest at heart. And so I'm asking the city of Ozark to do the same. Please partner with the schools, and please give us all a chance to kind of get our feet back under us, get those numbers pushed down so that we can all feel like we're in the best, safest place we've got. We really have nothing else we can do personally and as a community other than masking. We can do all we can to keep our economy open, but unless we have a mask mandate, for example, I'm not going to the Ozark Walmart anymore, even though they require masks. The last time I was there, which was yesterday, about 30% of the people weren't wearing them. And I feel like they just don't feel like the community is really pushing that. And so that's why I'm going to Springfield. My husband, who works in the healthcare field, was a victim of the layoffs. His position was eliminated because of COVID-19 and all of the lockdown, shutdown business that we had earlier this spring. I want to keep our economy healthy. I want to help Christian County. I want to help with that tax money and help our businesses. But if I don't feel comfortable going to those businesses, then I feel like I'm kind of stuck. And so I'm asking for your support. I'm asking you to help my children. They need their teachers. They need their loved ones to stay healthy. They need their education, and they need to be able to be there 5 days a week. And I need them to go to there 5 days a week. We have to work, right? And so even though our schools aren't in the business of childcare necessarily, we all depend on our schools. So I'm asking for your support, And please do this one thing that we can help each other out with to try to slow this spread. Thank you.
Yes, sir.
My name's John Mitchell. I heard about it on the news just tonight that we were meeting. I didn't see a sign about it or heard about it, but we took a pledge here tonight, said liberty and justice for all. I want my liberty preserved. I've watched the slippery slope all my life in this country. I heard a guy say something about, oh, the jobs weren't as shovel ready as we thought. I heard the doctor say earlier, it didn't transmit from the children to the adults as much as we thought. Dr. Fauci, what more could I say about the wishy-washy things going on? It seems that in the school, I don't have any children in the school. I'm sensitive to the teachers. They want to keep it safe there. Go ahead and put the mandate on the school. But I watch this city growing as it is. I'm more scared about getting run over in this town. It doesn't matter what kind of regulations are being put up. I'm scared to drive down these roads with the speeding around here. I'm more scared of getting killed of that than anything called COVID. But one of our great forefathers said something, when the government, when the people fear the government, it's tyranny. But when the government fear the people, it's liberty. And I'm standing for liberty.
We hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness, and that to secure these rights, governments are instituted among men, deriving their just powers from the consent of the governed. That whenever any form of government becomes destructive of these ends, it is the right of the people to alter or abolish it. Our founding fathers wrote these words in 1776, knowing that even in establishing this new government with these fundamental rights outlined, that there would come a day when those rights were going to be challenged. This is why there were provisions written in both the Declaration of Independence and the Constitution itself to stop man and government from doing so. The First Amendment allows us to air our grievances with our government, which is exactly what I've come here to do tonight. You see, I'm a free citizen of an amazing country. I have more opportunity here than anywhere else in the world because of those provisions in our founding documents. I have the choice to form my own destiny and pursue happiness how I see fit, and that includes the choice of whether or not I feel I need to wear a mask. The WHO has put out multiple documents and studies on masks in cases of COVID-19, and I would like to share some of the risk factors that they do list on that if you would like to check for that information. Improper mask usage can cause breathing difficulties for people like myself with asthma or other respiratory illnesses, development of facial skin lesions, dermatitis, worsening acne, carbon dioxide poisoning, and many other conditions. The CDC and WHO also warn that self-contamination of the mask is a large risk. They recommend that if a mask is touched even one time, it should be discarded and a new one should be put on. Now, with all due respect, each and every one of you here, while I've been standing here, every single one of you has touched your mask. So in that case, according to the WHO and the CDC, they are now completely ineffective. These organizations also warn that if masks become wet, they begin to harbor bacteria that can make the wearer ill. Now, I don't know about the rest of you, but with the feels like temperature being 100 degrees today, I start sweating as soon as I walk outside. How am I supposed to wear this mask effectively if I'm compromised as soon as I walk out the door? The most concerning piece of information to me is the warning placed on graphics for masks by the WHO itself. It reads, remember, masks alone will not protect you from COVID-19. Maintain at least 1 meter distance from others and wash your hands frequently and thoroughly, even when wearing a mask. This mask mandate is not going to save us from COVID-19. We must do what we've always done. Follow hygiene practices we've been taught since we were children. Cover your cough or sneeze, wash your hands frequently, practice good hygiene, and stay home if you're sick. It's high time our government remembers that we put you in place to work for us, and it is not the other way around. I would also like to share from those people who are on the,
I'm sorry.
okay, thank you.
Thank you very much. And I'm going to read names, and if you would please come up and start on this chair to my right. Dr. Ken Spangler, Randy Taylor in the second seat, Michael Bard, Lydia Shepherd. There are only 4. Are there?
I already got the other ones from.
Oh, okay. All right.
I got them from the other room.
Oh, all right.
Wherever you want.
Well, I'm sure not going to remember names in the order that they were called, so we'll just start over here. Dr. Spangler, I do remember that. Well,
Okay, well, let me get my glasses on here. My name is Ken Spangler. I'm a board-certified emergency physician and a master of public health, and I did contact your office to try and get on as an expert, and I was told to show up and fill out a card. Liberty is defined as independence from the arbitrary choices of another. That's exactly what this issue is about. Mandates and edicts have no place in a free society. The opinions expressed by the expert tonight fall into the category of arbitrary choices. At this time, our country is being ruled by fear. Yet the greatest risk is that we would sacrifice freedom to self-govern in exchange for some measure of perceived security. The proposal to mandate the wearing of a mask in public settings is before you. In this, a reasonable response, is this a reasonable response to the evidence? I say no. The pores in the surgical mask are between 6 and 40 times larger than the virus we're talking about. Wearing a mask to prevent inhalation of a coronavirus is no more effective than using a chain link fence to keep mosquitoes out of your yard. For unbiased data, we have to look back at studies that were done before the Wuhan outbreak. Studies then showed that a mask offered no protection from a coronavirus infection. A randomized trial from the SARS epidemic concluded there was no trend in the results suggesting the effectiveness of face masks for protection from the SARS. The Annals of Internal Medicine on July 7th this year reported a study in which it showed that neither surgical nor cotton masks effectively filtered SARS-CoV-2. Academia and the media have been very quick to publish all kinds of alarming information regarding COVID, and yet they've censored the frontline doctors. We have witnessed dehumanization caused by the mask wearing, separation of people, fear of other human beings affected by outrageous and false information propagated in the media. God gave humanity an amazing immune system, and all that these physical barriers serve to do is to weaken it. The best boost to the immune system is exposure to the environment. As articulated by the frontline doctors, if you want to wear a mask, go ahead, but it's not going to help. The healing of the emotional, economic, and physical health will be by a return to normal human interactions. A vaccine is even unnecessary. You have a good immune system. Let it do its job, and if you get sick, treat it with hydroxychloroquine, zinc, and azithromycin.
Dr. Spangler.
Thank you.
Thank you, sir.
My name is Alex Beckman. Thank you for giving me the time today to briefly speak to why I believe you should pass a mask mandate. This is my 10th year in Ozark Schools in the special education department. I'm grateful to have learned from each and every one of my students with varying levels of ability. I want to speak about people in our community that I know this pandemic significantly impacts. I want to speak about the at-risk population and students with disabilities. We have seen an alarming increase of COVID-19 cases in Ozark. The number of people in the United States that have passed away due to COVID-19 is now greater than the entire population of Springfield, Missouri. Every year at our schools, we do emergency drills on a regular basis. So we can practice what to do if there ever is a tornado, fire, earthquake, or even intruder or active shooter. When we go through intruder drills, we practice how to run, we practice how to hide, we talk about how to fight. Many of my students cannot run, many of our students cannot fight, and many of my students cannot hide. I have to fight for them, and it falls on me to protect them. I cannot protect them against the spread of COVID-19, and I implore you to pass a mandate, mask mandate. We must do everything we can to mitigate exposure to COVID-19, including social distancing, washing hands frequently, and requiring masks to be worn by our community. For some of my students, washing hands independently is a challenge and a skill we had to work on for a lengthy time. For example, one of my students had a goal to learn 2 out of 9 steps of washing her own hands, requiring adult assistance with this skill. And this was a goal she worked on for a year. She relies on her teachers, her family, and her caretakers to keep her safe. She relies on her community to keep her safe. A mask mandate is such a small thing, a minor inconvenience to us all to keep her safe. I think of my students that are medically fragile, many checking nearly every box of pre-existing conditions that make them at high risk for fatality from COVID-19. A mask mandate will help keep them safe. I think of my students that have seizure disorders and cannot wear a mask, as we must monitor their symptoms and mouth in case they have a seizure, and we must give emergency medication. A mask mandate will help keep them safe. I think of my students with autism. Many are struggling to wear a mask due to sensory differences and the feeling of it on their face being extremely uncomfortable. These students that are so reliant on structure and daily routines have seen that rocked by COVID-19. And yet I know that many of these parents and their service providers have worked tirelessly to help them acclimate and tolerate wearing masks. Our schools work together to help each and every one of our students learn the skills they need to become active and engaged members of our society and the community of Ozark. A mask mandate is the least we can do to ensure all of our children can live to be the future of our community. Governor Parson said that as kids return to school, quote, if they do get COVID-19, which they will, and they will when they go to school, they're not going to the hospitals, they're not going to have to sit in doctor's offices, they're going to go home, and they're going to get over it, end quote. With all respect to the governor, if many of my students with disabilities get COVID-19, they will not get over it. They will not simply go home, they will not be fine. Thank you.
Thank you. Yes, sir.
Good evening, and thank you for this opportunity. I've heard a lot tonight about the science as far as I hear a lot that it does stop it. I hear a lot of people say, we know it stops it, we know it stops it. What I've not heard is actually where any of that science comes from. The gold standard of testing, in my opinion, from what little research I have done, and by the way, I am willing to be swayed. I'm willing to be swayed to masks or anything. I'm not for them at the moment. But they keep saying it will help. We know it helps. The last RCT study that was done in 2015, and it referenced influenza. And it said that 97% of the particulates through a cloth mask make it through. So with that being said, that's the last study on masks and something similar to this that I know that was done. And granted, I'm relying a lot on Google and other places. However, that's the last thing I can find where I can go and see an effectiveness of a mask other than people saying, we did this, we did this, we did this. The gold standard for testing is, in the scientific community, I thought was supposed to be RCT testing. Since they have not done that, I don't know, the people that continue to say, I know it helps. I'm not 100% sure what they're basing that on. I do, however, know that I'm willing to look at it differently. I know currently, I just saw a report that the ADA is saying that due to the constant mask wearing, children and adults are starting to experience decaying teeth, gum disease, those kinds of things, which have health benefits. These things have long-term health results that have not had a chance to be studied. And I've not seen the science. I'm all for saving lives. I'm all for doing all those things. But I want to follow exactly what the doctors are asking us to do and follow the science. If someone will show me that, I'm more than willing to look at it. With that said, the other masks are more effective, but even those are not completely effective. So if you come to the decision to mandate a mask, then I implore you to do your research and come up with a plan that says we're going to mandate this mask because we have the science that says that these masks are effective. So if you're going to mandate the right one, because nothing I've been able to see so far tells me that a cloth mask is going to help somebody. I'm all for helping. I'm willing to do it. But you're going to have to mandate something more extensive than a cloth mask based on the science. The last thing I'll say is this. I would be more than willing to make a contract with anybody here in an agreement. I don't want you to be responsible for my health, and I don't want you to be responsible for mine. I believe that this community's done a pretty good job. If 4 people in the hospital is not a low enough goalpost, I don't know what the goalpost needs to be being honest. Thank you.
Thank you. Sir.
Michael Marr. The city of Ozark, now this is per your Facebook website. The city of Ozark will provide a staff member to clean the podium area prior to each speaker to ensure the safety of our attendees. Great example, guys. It's hard to argue a case when you only have 3 minutes to make your point against 2-hour-long dissertations from the expert doctors, but I'll try. But I want to refute a couple of points that were made by Dr. Bauman and Dr. Troutman. First of all, Dr. Bauman found it very prudent to take action in the middle and end of June, yet he stated that the cases didn't start increasing until mid-July. So we already had a plan going forward when the cases hadn't even increased yet. It seems interesting. Dr. Troutman took a drink of water from a bottle that was provided to him without gloves on and drank from it, hand to mouth contact. What good does the mask do if we provide hand to mouth contact? Okay. Then I heard him say that if we took the numbers out of the study, that the Springfield those numbers start reducing. If we take and manipulate the data, then it looks better. Okay, so I got a friend of mine that tested positive at the hospital. This is a true story. Went to another doctor because he was concerned about it. He got tested there. It was negative. The original test results could not be changed by the hospital because of their policy. The hospital agent said that it was because they would lose money if they were changed. So they kept a positive case. Don't tell me there's nothing political going on here. Tonight, we've had 2 speakers, 2-hour-long sessions, or shortly, maybe shorter, that one of them is in the sole business of making money by healthcare. If that's not biased, I don't know what is. We don't have any experts here that are on the other side of it. And many health experts can't even agree with each other on what the best policy would be. You need to listen to your constituents. More respondents voted against the mask than they did for it. The mask is only 7% effective. A cloth mask is only 7% effective. It should be left up to the government, or not, it should be left up to the business to mandate the mask and not the government. And the last point I'll make is this: 5.7 million people have died this year from coronary artery disease. Why has the government not mandated diet plans and exercise, or even mandated tobacco companies to stop producing tobacco, since the experts say that a low sodium diet, exercise, and no smoking are ways to prevent it? My last 4 points are this: how have we survived this long without masks? Number 2, COVID's going to be eliminated in November. Number 3, nobody takes into consideration the amount of increased testing. And number 4, how do I get a refund on my taxes that I paid for the school that's going to close, and that closed from March to May? Where's my refund? Thank you.
Evening. My name's Bill Ashenfelter. I'm retired health inspector from the city of Springfield.
You need to speak up, Bill. There you go. Thank you, sir.
I retired from the Greene County Health Department. I was there 30 years.
I'm in favor of masks. I've made some notes here. Really can't compare flu and corona because with the flu, you have some resistance after you've had it. With corona, the antibodies are gone in a matter of a few weeks, and you can catch it again.
Can you speak a little louder, sir, and into the mic?
Yes.
Thank you. You're welcome to try to tilt that mic down. Just beware.
I really don't see wearing masks any different than putting your child in a car seat. It's just common sense. You can't say that a mask doesn't stop virus particles because of the size, because the mask is designed to stop mucus and saliva when you sneeze or cough or talk or sing. It does stop the mucus. It's not going to stop everything. It does help. That's pretty much proven with the barbershop here. And the only thing I could see that be a possible bonus is if we increase testing. I don't know how we're going to test kids in schools, but I live with my grandkids and they're going to go to school. I'm happy to know that I read today that there's so many more cases in children, but they're not showing symptoms. They're not sick, which gave me a great amount of relief. Also read today that the neck gaiters, they call neck flannel, are worse than nothing, but ones the officers have a filter inside, so they're fine. The masks that allow smaller particles through are worse than nothing because if you cough or sneeze and it's all big chunks, it's going to fall within a couple of feet. You sneeze outdoors. Without a mask, it can go up to 18 feet in 2 seconds. And there's talk of 6 feet distancing. Social distancing isn't adequate, even with a mask. Depending on the mask, some of them are better than others. The ones that only work, the ones that work are solid plastic. Anything else is something better than nothing, except for single layer cloth.
Your time is up, sir. Thank you very much.
Thanks.
Yes, ma'am.
So this virus started at the points of entry, pretty much in the United States. It's just made its way here. It's only just begun in our area. I am a single mom. I have 2 daughters. They're both teenagers that attend Ozark. One is in the IB program, straight A students. They're not going to school. I'm doing virtual learning for them. And the older one's pretty upset. She wants to go to school. It's not safe right now. I work in a nursing home. I pass medication to the elderly. If they come home with it, I get it. We'll probably be asymptomatic. We'll probably be okay. I may be hospitalized, possibly die. But if I take it to work, there are going to be mass casualties for my residents. I hear a lot of talk about my right to life and liberty. Well, guess what? I have that right as well. My residents have that right. So for you to not put a piece of cloth covering your nose and mouth so that your spittle that might contain coronavirus doesn't float out and onto everything else, that should supersede my rights to a healthy life, to my residents' rights to live. They haven't had any visitors, no physical contact from their family members since March. 6 months, and there's no end in sight. The best they get is a family member on a cell phone outside their window. The people can't hear them. They're 80 and 90 years old. They can't even hear them. They can't touch them. It affects so many other people, and it's time that we listen to the specialists, the epidemiologists, the professionals who know what they're doing. I get that it's emotional, but we need to put our selfishness to the side and think about everyone in the community. Thank you very much.
Thank you. All right. Oh, you have someone unmasked in the other room? That's Zoom in, okay. All right, Keith Steenberger and Connie Dodge. Samantha, this gentleman is up here, was he, did I miss him? No, I'm on the next room.
He's on the next group that I got from the other room.
Oh, okay, from the other room, okay. Very good, thank you. Now, are you two on the second row, ones that were called?
Yes, they were from the other.
Okay, so I've got 5 people here. No, as long as I know you're to be called, there are these 5 people, is that it, Samantha?
Yes, all these people right here, and one more from the out.
Oh, and one from the other, okay, because we're doing 6 at a time. All right, please, sir.
Thank you guys for your time, for opening it up for the community. I'll just tell you real quick. My name is Keith Steenbergen. I run nursing homes. That's what I do. So I know I deal with every day, I have since March, with those who are the most affected or most vulnerable to this. And to be putting your faith in a mask, thinking it's a magic bullet. I've listened to teachers, I've listened to everything they've had up. I deal with Dr. Troutman all the time in what I do. Respect him as a man, I respect what he believes. But everything he answers, he talks about, I don't know. Maybe. What if? Who knows? If you guys are really going to be voting for something that is going to be put on your citizens, I've never respected a business owner more than anybody until I heard the folks with the vineyard. You're putting your faith in something that doesn't work. I'm tired of listening to people who, I respect your opinions. I do. I respect people for what they do. I respect you guys for what you do. But putting a mandate on your citizens or where I vote, I won't be doing business in this town anymore. All the time we talk about, I had a meeting today with 150 people that I work with. They work for me. They trust me and they trust me my leadership and what I give them. Now it's not the same as you're dealing with the whole town. And I get that. But my people know that we will follow the rules of what the government says, but we're going to rely on what we know works. The washing the hands, your distance. If you think I'm going to have elderly folks that are going to wear a mask all the time, they don't. I hear a lady before me who spoke and said she works in a nursing home. I respect her opinion. I don't want any of my residents to get it. I deal with a company, we have other homes that have had it. One of the first ones in Grandview that had a lot of death. Why did that happen? Because the hospital made a mistake. Not to blame anybody else, but that's what happened. This is back in March. I'm dealing with people right now down in Branson. Every home down there that has it, I deal with them. That's my company. I have to deal with them every single day. We wore masks in nursing homes since March. It was a mandate in March. So tell me how they got into the nursing homes in Branson. The mask is no cure. You're putting your faith in something. I feel like I'm talking about snake oil. This mask has nothing to do, it's not going to cure anything, it's not going to help anybody. And if whatever your goal is, if your goal, you think you're going to keep the schools open because we wear masks, it's one of the most ridiculous things I've ever heard. If we get coronavirus, it's going to come in. We have to deal with the symptoms that are there. There could be people right here, right now, and I'm talking to you, and I understand that have it and are asymptomatic. You all got a risk. You came here and you risked your life to come here. Of course, that's what we're talking about. I risked my life driving from Springfield to here after work tonight to try to get here in time at 6:30 to turn a card in so I could talk to you after 9 o'clock. One of my best friends in the world, their brother had an accident last night and broke their neck. But we don't talk about those things. If we're here about talking about mass, I just letting you know
It's a very false sense, and it's not going to cure us.
Hi, my name is Connie Gotch, and I've lived in Ozark for 13 years. And I agree with most of the people that said no masks. The one person I have a really hard time with is stand up against those who don't wear a mask. What are they gonna do? Is that the community you want to live in? That we're tattling on people because they don't wear a mask? That we're all police officers? Sounds like communism. Patrick Henry said, "Is life so dear or peace so sweet as to be purchased at the price of chains and slavery? Forbid it not, Almighty God. I know not what course others may take, but as for me, give me liberty or give me death. It's my choice to wear a mask or not. It's not yours." Mayor Gardner and the Board of Aldermen, you were elected by the people. You work for us and the people of Ozark. And I do not give you permission to make me wear a mask. Very good.
I think I've heard me so many times since the grandson was 4 years old.
Can you step up to the mic, please?
It is, it's, the mask is not to protect me from you. It is to protect you from me. It is not, I'm not worried about, I'm not here to, I don't want to get the germs from somebody else who is not wearing it. And that's the thing. It's not, you need to quit being me. That's our problem in this country. It's all me, and my rights, and that's why we are the one country that cannot get it under control. This should be a temporary thing, agreed. A couple of months, if you see it's working, fine, keep it going. But it's almost like people I'm hearing are like, until the bodies are piled up and the refrigerated trucks are here, it's not a problem to us. And it's not a problem to anybody until that tube goes down your mother's throat or your kid's throat, or your child comes home and has lifelong problems because they are having it. But, we pass ordinances all the time. I wear clothes in restaurants, I wear my seatbelt. I don't smoke because, yes, that's not good either. This is a temporary plague and a temporary moment in time. If our hospitals become overrun with COVID and you're the one that goes in with a heart attack, the doctors are up there working COVID. They've got to get all undone with their clothes, come down, put on new stuff to take care of you. That's minutes that you're laying there, somebody's pounding on your chest, trying to keep you alive. And our economy and our lives will never go back to normal as long as people are afraid to go out in public. Quit listening to gossip on Facebook and the conspiracy theorist websites. Listen to real medical professionals who have firsthand experience with the disease. Maybe the reason you couldn't find any opposing view towards the medical people, maybe there isn't much of one in the medical community. And finally, to all the what would Jesus crowd do? Jesus would not scream at their neighbors. I don't care about your health. Your dying is not my problem. And that's just, just look at the facts. It saves lives. It stops my germs, which are spewing at you right now, I'm sure. But, I think you should do it for a temporary time, 3 or 4 months, and see if it helps. Before the trucks have to come in here, the refrigerated trucks.
Thank you. Yes, sir. Yes, sir.
Mayor Alderman, can you hear me?
Yes.
Let me preface my remarks. I fall into one of those high-risk categories. I'm immunosuppressed. I've been taking prednisone and rituximab infusions, and so I'm immunocompromised, and my immune system's going to be whacked probably for the next 6 months to the year. So I take SARS-CoV-19 very seriously. Having said that, I'm more concerned with the government overreacting to the virus than contracting the virus itself. The CDC's own website has stated that wearing a mask is wearing a cloth mask rather is not an effective substitute for social distancing, and that it is designed to prevent the mask wearer from infecting other people and not to protect the mask wearer from the virus. So that's saying that the cloth mask can stop COVID-19 from being inhaled, or stop it from being exhaled but not inhaled. And that's not the consensus of the scientific community. The National Institute of Health, the New England Journal of Medicine, rather, found that SARS-CoV-19 exists in the air as aerosol particulates of 5 microns or less. Now, there's only one mask that can prevent something that small from transmitting, and that's the N95 mask, which we all know is in very short supply and reserved for the medical community, even if you can get your hands on one. Now, that's not my opinion. That is, according to a study published in Nature Medicine Journal entitled Respiratory Virus Shedding and Exhaled Breath and Efficacy of Face Masks. And that study said there's only one mask that can prevent the spread of SARS-CoV-19, and that's the N95 mask. Also, Dr. Elisa Brousseau, Doctor of Science at the University of Illinois, Chicago, wrote a position piece that said, masks for all, COVID-19 is not based on sound data. That's the title, so you can imagine where it went. And which I quote her article in this, what we are seeing is a lot of magical thinking, a lot of wishful thinking. Cloth masks are wishful thinking. And then one more study, the National Academy of Sciences Rapid Expert Consultation of the Effectiveness of Fabric Masks for the COVID-19 Pandemic, NAS 2020, said it's not effective categorically. Cloth masks are not, and N95 masks are. So there's a big difference between using science to, I'm sorry, my friend, your time is up. Oh, I'm sorry. Thank you. Thank you.
Thank you very much for letting me come in here and talk tonight. I appreciate it. I am a local business owner. I did move into this town 15 years ago, raising a family. I started a business from scratch with a lot of trouble getting that business open. I went and jumped through a lot of hoops. The city worked with me. Things are going really well. We generate a lot of revenue here. This will destroy my business. My business is a social atmosphere. People come in, they sit around, they talk to each other, they communicate with each other. The community that comes in there does not do it. I have people from out of state. I have people from everywhere in this country traveling through Branson, stop into my business, walk in with a mask on and go, oh my gosh, I can't believe we aren't forced to wear a mask in here. Thank God I can enjoy it and talk to my friend across the table and listen to music. We shut us down for 2 months, beginning of the year, about put us under after 4 years of struggling just to come up in this community to try to provide a place for people to go. We shut down. It took everything my family had. I lost my 14-year career job that I had because of COVID-19. This is not a good thing. We need to understand that we are not here tonight to vote on school wearing masks. I respect the teachers. I appreciate the teachers, but we've already put in a policy through the public school system that we're going to wear masks. Thank you, teachers, for everything that you do, but that's not why we're here tonight. We are here tonight to discuss the community, not the schools. If the kids can't carry it, don't need to worry about it. This community needs to be able to go out in public and enjoy themselves. Not being able to talk to not a single person could stand here a foot from a microphone and discuss tonight so anybody could hear them. You can't talk to each other. You can't communicate. I don't care if you're 6 feet apart at a table. If I can't hear you, there is no point in me going out to dinner with you. This is ridiculous. Our community doesn't need this. If you want to wear it, that's your choice. And I will not tell someone they can't come in and not wear it. But I will not tell them they can't come in if they're not wearing it. And I have to be very clear that I don't support this. And this will not support my family or my business that I've worked and strived so hard to get. Thank you.
Oh, I'm sorry. Yes, we have. Go
Are you
ahead.
guys ready? And so I'll keep track for her so she can see. You have 3 minutes. Can you see? Can you see her?
Oh, sorry, yeah,
That's good.
right there.
Yes, ma'am.
I live in the city of Ozark almost all my life, and I am against you in trying to make us wear masks. I was in Burger King a while ago and ate lunch, first time since this has started. And I think the economy is going to be better for Ozark if we don't have to wear masks all the time. And people can go in and eat, go to church. Right now, all the churches are opening back up. And I'd hate to have to go to Dixon to do my shopping. So thank you.
What? Oh, the next speaker, okay. Steve, as I call your names, will you please come up and have a seat? Steve Wright, Petra McCoy, Elijah Tomans, okay, and Brooke Henderson. And Brooke Henderson may be in the other room, okay. So those three. We did have a requirement for wearing a mask in this room. There is a lady in the other room that's not wearing a mask that will, so. Well, point made. Are you volunteering? No. That was a joke. I'm sorry, that was a bad joke. Just discount that, please. Yes, sir.
My name is Steve Wright. Mayor Gardner. I don't know if you remember me from real estate from way back.
I remember the name, sir.
Glad to be here. I think this is, I've always thought from the very beginning of this virus that it was more fear than anything else. And I don't know, I've never been afraid of it myself. I'm at the age where I should maybe be concerned about it, but I don't know. It just always hit me that this was way overblown and that it was not near as scary as people are making it out to be. And I know there's a lot of Christians and church people and Bible believers in here, and I had that scripture that says, God, well, wherever it is, I wrote down a few notes here. God has not given us a spirit of fear, but of power and love and a sound mind. And I think the fear kind of corrupts the sound mind. It's made people, they're not thinking clearly. I mean, I'm not a scientist or a doctor or anything like that, but I try to use common sense and I go by the numbers and I just don't see it. I mean, it's like, there's 38,000 people a year killed in the United States in car accidents. And I know how we can prevent that completely. The 38,000, I know how we can keep anybody from being killed. We lower the speed limit to 20 miles an hour. And that'll take care of it. Nobody will die of it anymore. But I'd like to see a I'd like to see everybody raise their hand. They're in favor of doing that. To
Sir?
save the lives.
Sir, you're addressing the board.
Okay, sorry. But anyway, we're not willing to do certain things. It's just a trade-off between convenience and saving lives. And I don't know about the masks. I just think that it's not good to be breathing carbon dioxide all day. I feel sorry for these employees that, they're in there 8 to 10 hours a day breathing their own carbon monoxide. It can't be healthy. And I just don't see it as being a good thing.
Sir,
It's all about fear.
your time is up, sir.
Okay.
Thank you. Yes, ma'am.
Hi, I'm Petra McCoy. I have lived on a farm in Bruner for nearly 3 decades. I'm definitely a member of this community. The thing that concerns me, I would like you to not blindly take over what Springfield has. I personally have no problem wearing masks inside. However, when it comes to outside, and then you attach legal jeopardy to it, it feels like a police state. And I'm a Cold War kid from Germany. I have heard from my relatives on the other side of the wall back in the day what a police state feels like. I want you to really weigh heavily against forcing us to wear a mask outside. And even when we were during lockdown and we were not supposed to go out, for any reason besides going to the store, if I drove to Ozark to get diapers for my new grandbaby, I was worried that I would be pulled over and come, what are you doing? I seen your car yesterday. And it's a scary feeling. So I would like you guys to really seriously consider not taking over the rule about masks outside. That is all.
Thank you.
Thank you for this opportunity to speak. And being a resident of Ozark for over a year, I have no political bias, but I left the city that was becoming very destroyed by liberal leaders. And I've lived many years in very oppressive, nearly communist countries. And these actions are not American. These are communist. It comes straight from the communist playbook. And in Ozark, in Christian County, we have 90,000 people. Out of those 90,000 people, 395 have gotten COVID-19. That's 0.438888, et cetera, % of the population of Christian County. We are not going to sacrifice our freedom for the security of that many people. That is ridiculous. The majority of people here want their freedom. I want liberty. That's what we fought for. That's why we are Americans. I will always stand for my freedom over my security. Thank you.
Well, clearly I had no intention on speaking here tonight because I might have dressed up, but I just came to support some friends and thought that I would speak up. I'm coming to you. My name is Brooke Henderson. I'm actually from Springfield, live right on the border of Evans Road. I am the granddaughter of an Iwo Jima Marine first wave survivor who went on to own a very successful business long after the war. I'm the granddaughter of a female Navy veteran who served in World War II. I'm the daughter of a physician here in Springfield, Missouri. I'm the future mother-in-law of a COVID nurse in Arizona. I have a lot of expertise. I'm also an educator, special education, 20 years. I speak up not only on behalf of the kids with disabilities, because many of those kids cannot wear a mask. We talk about the kids with disabilities that can't wear a mask, but we don't talk about the adults with disabilities that can't wear a mask. There is bullying to no end every day via news, social media, when you go into places. It is wrong. It is harmful. We are hurting our children and we are hurting our community. People have a legitimate health reason for not wearing a mask. Now let me tell you, I see the clock's got started late. I got a few bonus minutes. But I want to tell you one thing about the city of Ozark. I live close. I watch it on Facebook. I watched what took place in this community when Springfield had an officer hurt. An officer down in your community stepped up. Your business owners stepped up. Cafe B29 and Vineyard are my two favorite restaurants, which I might not have discovered had Springfield not issued a mask mandate. But because of mask mandate, I love my favorite restaurants like Karai, to come to Ozark and give it a try. And what I found was the most welcoming, the most amazing environment where I can sit in a parking lot that is so cool and so chic with the thin blue line flags flying around it. And it reminds me when I come to Ozark what it means to be an American citizen and what life can be like. Again, I am in the high-risk community. I also have a mask exemption. I have lung damage, scar, and again, the daughter of the doctor. I don't wear my mask because I believe in Jesus Christ and I believe my days are numbered. But I also would like to share with you from the World Health Organization the potential hazards, the disadvantages of wearing a mask, potential self-contamination that can occur if medical masks are not changed when wet or soiled. This can create favorable conditions for microorganisms to multiply. I've watched in the room, people put their mask here, and guess what? Even the experts took their mask out from under here where somebody else just put it, and they put it back on their face. We've created a favorable organization. It also says that they don't recommend wearing a mask for people who have breathing problems, myofascial surgery, or that live in hot, humid environments. I don't know if you stepped outside today. It was a good 96 degrees. Most people's shirts are wet. When you start breathing, your mask becomes wet. Then it turns into this favorable, right here on the World Health Organization, community for microbreeding. So again, as an American citizen, as the granddaughter of a survivor of an Iwo Jima Marine first wave, I ask you to speak with your hearts, to speak with your head, and to pray for your decision. Thank you for your time. Amen.
Thank you. That's all. All right. Yeah. Yes, let's take a break. Let's take a 5-minute break or so. is Alderman discussion and Alderman comments. So I'm going to turn my back to you because I cannot see them. So I apologize, but that's the only way I can really effectively see who wants to speak. So we will open this up for Alderman comment. Lady, gentlemen, Mr. Poston.
Yes, I'll go first. I don't have a coherent set of thoughts I want to put together tonight, but I did want to share what's going on in my head. When this all started for us back in March, no, the kids just went on spring break, and a week-long spring break turned into a 2-week-long spring break, turned into a semester at home. Somewhere in there, the communities begin to shut down, to issue shelter-in-place orders, stay-at-home orders. That seemed to work pretty well. Hospitals built out facilities, manufacturers ramped up PPE, got a little better grasp on what we were dealing with, and everybody got antsy. And we opened back up, and COVID cases went through the roof. That's kind of where we are. And I worry terribly about school. When the kids go back next week and a half, 2 weeks, man, a single family, a couple kids riding a bus in a couple of different schools. It could be, schools could have serious potential to be a vector for transmission, and that terrifies me. I worry a lot about the things that we don't know. When this thing hit Europe, we saw how hard it hit Spain and Italy, populations that have a lot of smokers, and of course, being a respiratory disease, it is devastating in those populations. Now, here in the States, smoking's on the decline. How many of your kids vape? Vaping will screw your lungs up terribly before we even get to COVID. So I'm concerned about that. I don't know if we.
Yet it's still legal.
Yeah.
Okay.
So, and I'm glad you brought that, because that's something else that's been really weighing on me. I have no desire to tell anyone what to eat. You can eat junk food, unhealthy food. This board, and me personally, I hope this board has no business in your individual health, and I don't want to be in your individual health. And not once tonight have we actually really talked about individual health, at least not in this bill. We talked about the public health. It's what it's all about. It's about the public health. You think I'll enjoy sitting up here all night wearing this? I hate this thing. I spend every second I can that I'm not at work outside, so I don't have to do this. We know that if you're outside, UV light works pretty good. You got wind currents, et cetera, et cetera, et cetera. Indoors, nursing home guy would know that you get indoors. We see this on Navy ships. It gets in that confined area, it gets transmitted through the HVAC. In an indoor space, it can wreak havoc. And winter's coming. Pretty soon we won't be hanging out at the lake or the river or whatever. We're going to be back indoors. I worry about it. It's not the statistics of it, the mortality or the fatality rate, even the hospitalization rate is scary. It's more than we're accustomed to dealing with, but it's not the end of the world. But when you apply those stats back to Ozark, that is scary. It brings it home. 22,000 people in Ozark. And a fatality rate of 0.5%. Is that what it is? Something like that? I'm talking about We haven't had it here yet.
Look up
We
the
have had,
number.
no, I'm not gonna respond to everything.
This is Alderman comment. Everybody has had their public time to speak. Now, I'm sorry, I don't like this, and I know you all don't like this thing. This is no fun. But you are welcome to listen. This is Alderman comment. Mr. Poston, it might be a good idea, Mr. Poston, if you would address your comments to the alderman instead of to the public, because they are feeling the right to interrupt you.
Fair enough.
Just wonder why we had this after the election
Nothing but
instead of
fear.
before.
Just fear, fear, fear. That's all I hear.
My-
Worry, worry, fear, fear. Tired of it.
I am tired of the interruptions. Okay? I'm sorry. We're trying to hold this. You know, I used that gavel once before.
I'm done anyway.
Okay, see you, Steve. And I apologize for using that too much the first time. Okay, but I want to let everybody speak, but we've got to be orderly about it. So please.
There's been, I didn't hear it a lot today. We got a lot of emails. With last 2 weeks, I haven't responded to anybody's email. I haven't answered the phone unless you happen to just catch me. I have responded, or I have read all your emails. I have, listened to all the voicemails. I wasn't gonna debate this one person at a time throughout the entire city. I wanted to wait until tonight and next week. But yeah, I don't think it's fear. I think my entire life, I have had people sit there and shout, why can't we have common sense government? Why can't we have common sense government? Where is common sense government? We have a virus in this country and in this community right now that's wreaking havoc and that we don't fully comprehend. We don't fully understand it yet. And we're gonna send our kids back to school. We're gonna open up our businesses. We're gonna pretend that nothing's going on and we're just gonna go about our life. I don't see the wisdom in that. I do not see the common sense in that. I don't get it. I have tried as hard as I possibly can to wrap my head around all the arguments that are being made. And some of them are, I think some of them have merit. I'm not saying they don't, but so many of them, I just don't get it. I'm not going to dispute facts. I'm not going to dispute stats. I felt like everybody tonight, for the most part, relied on pretty reasonable sources. I appreciate that. I don't have any problems with a lot of the statistics that were quoted or the studies that were quoted. But even in those, even when we talked about masks, somebody got up here and said that cloth doesn't work. Somebody said that cloth is actually better than the surgical mask. Somebody said that the cloth masks work because when you breathe out, there's a certain amount of mucus that gets trapped in the mask, where if you breathe out dry, we don't know. But yet, we keep pretending that we do, that nothing's going on. And it worries me. 2 more points and then I'll hand this off to the other alderman. A lot of the emails I got and a couple of the phone messages talked a lot about personal responsibility. That's not even a factor here for me. Personal responsibility, folks, is when you suffer the consequences of your actions. If somebody else suffers the consequences of your actions, that's negligence, not personal responsibility. And in this case, there is nobody in this audience, even a guy that just got mad and walked out here, there is nobody in this audience that wants to hurt anybody. Nobody, I truly believe it. I don't think anybody here would go to Walmart without a mask if you knew you were carrying, even if you were asymptomatic or pre-symptomatic. I don't think you would do that. Nobody wants that. But we're doing it. That was how it's spreading, because we are doing that very thing. This is one of the hardest votes I've ever had to do. This one's not going to be easy. But the duty of an alderman is to the community, and it's going to be hard to get my head in a spot where I would not be willing to support masks. It's going to be hard to look at the people that have begged us to do it and tell them, no, I understand you're a doctor, but I don't want to listen to you. Every decision this board's made, we have generally tried to listen to our advisors. I'm not sure if we're gonna start debating with Mr. Parsons now about how thick asphalt should be or what size sewer lines we wanna use.
The doctor sat up there and said he didn't even know.
Come on.
And I agree, I don't either, and that's what makes me nervous. That's my comments for right now.
Thank you, sir. Any other alderman, alderwoman? Mr. Schaefer?
I'm opposed to the mask ordinance. I've been pretty vocal about my position for several weeks now. There's lots of reasons. I certainly believe that masks do help limit the spread of the droplets, the coughing, and the sneezing. But I also believe it provides people a false sense of security. I believe some people view it as a cure that'll keep our schools open, that'll keep our businesses open, that'll keep our friends and family alive. The reality is this is a virus, and people are gonna get sick, people are gonna pass away, we're gonna mourn as a community, and we're gonna grow, we're gonna move on. When I look at government, I look at government being one that should, educate, should recommend, should advise, especially on the local level. And I saw that in July when local agencies got together and put together a program to try to educate the public on the use of masks. I do believe in the community and that voluntary compliance is the way to go. I believe it's a slippery slope when we start creating mandates and laws and ordinances out of fear and with a lack of knowledge. I asked Dr. Troutman specifically, what would be the rate of infection of an individual within 6 feet without a mask? He didn't know. What would be the rate of infection of an individual with a mask within 6 feet? He didn't know. When we try to govern 20 or 25,000 people, I'd like to have some of those details and that information before I decide to take away people's liberty. I hear a lot of arguments that the wearing of a mask is not much of a liberty. It's still a liberty nonetheless. It's still a decision for an individual to make. And if I'm going to force that person to give up that liberty, no matter how minor some people might think it is, I still need more information and belief. That's going to do more good than harm. We're at a difficult time now in our society. Literally, cities are burning across America. We have had more people in this room today express their views emotionally than I've seen in years of being an alderman or years of being on the campaign trail. It's certainly a sore subject. It's a subject of great discontent. And I think it would be a mistake for the Board of Aldermen to wade into that without knowledge that what they're doing is right and not knowledge of what they're doing will make a difference. So wear your mask if you choose to, but I'm not going to be one that's going to order you to wear a mask. I'm not going to be one that's going to punish you if you refuse to wear a mask. I believe the aldermen should really stand up and listen to the public. The majority has spoken both in surveys and here tonight. We recently had an election where 4 candidates for state representatives said they wouldn't enforce a mandate. 5 candidates for county commissioners said they wouldn't enforce a mandate. The city of Nixa voted 6-0 not to have a mandate. I can't believe that all those people are wrong. I would encourage my aldermen to not give into the fear and the concerns, but rather stand up for their citizens and vote against this mandate. And if additional information comes in the form of studies or additional information that is more reliable as to the rate of infection that Dr. Troutman can share with us, and there's an absolute certainty that wearing a mask will save someone's life, I'm all over that. But when I hear Dr. Baumann says, if just one less person gets sick, that's a very low standard. That's a standard that can be met quite easily in many situations and would be enforcing mandates on numerous things. I also have a fear that this is going to be used to mandate vaccinations. That's also an issue that's very sore with a lot of people. And it's a slippery slope when you start as a community mandating certain things for the public good without all the facts because it makes it easier. One of the common arguments I hear from aldermen is that we have an ordinance for this and we have an ordinance for that, and we have an ordinance for this, therefore we should do this ordinance. If anything, that just reinforces my belief we have too many ordinances. The government's too involved in our lives in every aspect, and slowly it's whittling away at the liberties that we share. So I'm going to vote against this mandate, and I'm going to encourage my aldermen to also vote against it.
Galloway.
Mayor, I have a few questions for the city attorney and explain the ordinance. Ms. Calloway, can you walk me through the ordinance? Just take it paragraph by paragraph and just explain, in addition to reading, just explain how that is, how that works.
I will. First, I'd like to state that this ordinance reflects what similar communities have proposed, so it would be a regionally similar to what was proposed in Springfield and Nixon and other communities. The first section that you find has definitions. I won't read through the definitions, but the word business, face covering, and public accommodation those three are defined. Most importantly, public accommodation is referred to herein as a facility that's open to both the public and the private, including businesses and other public locations. Face coverings are going to be required in all places where public accommodation is open, and it will be beginning over the age of 10. A person may remove their face covering under the following exceptions. So the bill sets forth first the requirement, and then it sets forth exceptions to that requirement. The exceptions include, while outdoors, when able to maintain a distance of at least 6 feet from others. It does have an additional exception for if those individuals are from the same household, they do not need to maintain 6 feet from each other because they would be in the same household. When engaged in an exercise activity outdoors or indoors, and while able to maintain a distance of at least 6 feet, the same exception for the household members also applies in that exception. While eating or drinking only when inside or in the outside dining area of a restaurant or other establishment that offers food or beverage, provided that they're able to maintain a distance of at least 6 feet from persons seated at other tables. So that doesn't apply at the same table. Again, these are exceptions for when the mask may be removed. When an individual has a medical condition, mental health condition, or disability that prevents wearing a face covering. When any party to a communication is deaf or hard of hearing and not wearing a face covering is essential to communication. While obtaining a service, such as a dental examination or other service that would require the need to remove the face covering. And then there are several exceptions for when a law enforcement officer or when it's necessary for identification purposes to remove the face covering. There's an additional exception that allows the mayor, through the authority of the Board of Aldermen, where they delegate that authority for the mayor to enact additional exceptions as may become necessary as this evolves. The paragraph that immediately follows the exceptions, it explains that if you fall within one of the exceptions, you are required to adhere to the other requirements, including social distancing and trying to maintain that 6 feet of distance between themselves and others. It requires that all places of public accommodation shall require face coverings as described in the ordinance, and that they shall post a sign requiring such. That brings us to the last paragraph of the ordinance, which includes the violations, and this is where it sets forth the penalties. It's important to note that the city has a general penalty section, and the general penalty section, as authorized under the state law, gives the city and the prosecutor the ability to set a range of penalty from $0 to $500 per violation. This ordinance actually lowers that standard to a $100 fine. So it lowers the threshold, so you cannot exceed $100. So $0 to $100 for any person who fails to wear a face covering, or any person who owns or manages a place where it's a public accommodation and somebody fails to wear a face covering and they fail to remove them from that location. Do you have any questions?
Yeah. There was a provision in there that provided some flexibility for the mayor, I think. Oh, sorry, was I not supposed to?
No, I was just reminded that Ted needed to speak. I don't know where to speak. Mr. Smith, you'll be next. Okay, Mr. Galloway, continue.
Okay. Does that require any further action of the board for the mayor to do anything, or does that give him some freedom?
It does give the mayor freedom. So once this ordinance is enacted, it delegates the authority to the mayor to decide if additional exceptions are available and that he wants to issue an order similar to the orders that he's already issued.
I'm thinking of school and school athletics. Would that fall within the exception? Do you think if the mayor decided to adjust so that we wouldn't be conflicting with school policy?
Yes, the mayor could do that.
And if we were to apply the ordinance today, in this room or at the OC, how would that apply? This room, these people, how would that work?
In the OC general and in this room as a public accommodation, there would be a requirement that the OC not only post a sign stating that a mask is required, but also that all individuals that don't fall within an exception wear a mask in this facility. In this room, we're not engaged in any sort of exercise activity, so that specific exception would not apply to us. However, if we were engaged in an exercise activity, since this is a gym, I should, I guess, explain that we're inside a gym. If you were in that activity and able to maintain a distance from someone that's not within your household of 6 feet, then you can remove it.
And if I'm outside the OC talking with Alderman Schaefer, how does that apply?
If you and Alderman Schaefer can maintain 6 feet between yourselves, then you do not need to be masked. The only time it's required outside in a place of a public accommodation, so that would be like on this facility grounds, would be if you were closer than 6 feet. But if you were, let's say, in a place that's not considered public accommodation, on your own property, you would not need to adhere to this.
And did I understand that there's a family member exception?
There is. So if you and your wife were walking on the OC's property, since you live in the same household, you would not need to both be masked because you wouldn't need, and you would need to maintain the 6 feet distance.
Okay. Thank you.
Mr. Smith, can you hear us? Where is Ted? Can you hear Samantha? I don't know what to do, but.
Got it. For some reason my was not taking. I've got you. This is.
Ted, hang on for a second. We got a sound problem.
Hey Ted, test it again for me, please.
This is a test one.
Test again for me.
Test 1, 2, 3.
Hold on. Test again.
Test 1, 2, 3.
Sorry, Ted, I'm trying to figure out which one's best.
Test 1.
Let's try this. Okay.
Try again for me, Ted.
Test, 1, 2, 3.
Sorry, guys, hang on. Trying to figure out which one's the best way to do this.
I hear you great.
Yeah, you're coming through my computer and it's not going through the system. And when it does go through the system, it's too loud.
Ah, okay.
That's what I wondered too, if that would work. Try again, Ted.
Test, 1, 2, 3.
Not loud enough. You there still? Keep testing with me.
Test, 1, 2, 3. Test, 1, 2, 3.
It's like has a kind of like a echo through it. Hang on.
I hear it. I hear it.
Yeah, hang on, Ted. I'm gonna go run and grab some different speakers. Give me 1 sec, okay? Does someone else want to speak until I can get Ted taken care of?
I would agree to that.
While Samantha's trying to figure that out, anybody else like to speak while we're waiting for Ted? Heather or RJ or?
The Bill Aker, the senior center, I talked to him on the phone. He asked me to read a statement. I asked him, if he wouldn't mind, just coming in and providing it, but he's older and in the high-risk group and didn't want to take a chance.
Is that public comment? Would that not be considered public comment? And public comment is
to the mayor. I think I.
Go ahead, that.
Okay.
Feel free to
All right.
proceed.
The Ozark Senior Center has been closed since March 13, 2020 due to COVID-19 and
What are we doing?
Of Eastern Christian County senior population. At this time, we have no plans to open anytime soon as the number of cases continue to grow. Since March, we made home deliveries of food, masks, plus information to help guide the seniors during this unprecedented time. The OSC has been minimally staffed to provide meals for those seniors who wanted to continue to receive meals that ordinarily would attend our daily lunch.
Can I make a point of order?
Our staff follow CDC protocols with mask, gloves, and proper cleaning to keep our seniors safe. During this time, we have delivered over 5,000 meals to the home bound. We also continue to provide bus rides for medical needs, especially dialysis. The seniors, which are the most susceptible group to be attacked by the virus, do all they can to avoid contact and protect themselves by masks and constant washing. They are using the recommendations from the Ozark County Health Department and the CDC. The masks seem to be most consistent of all for prevention. This is especially true as they leave the house for groceries, medical needs, and other reasons to be out in the community. Unless we are on the same train of thought and practice the safe habits of masking, it will be necessary for the majority of our seniors to stay at home as our active cases continue to climb. Damage done from seniors being secluded has not yet been measured, but from numerous conversations, it is far more damaging than requiring the use of masks. Approximately 20% have not left their houses since March. The seniors of Ozark are 100% behind your vote for the mask mandate. Regards, Bill Aker, President.
This is not his comments. This is public comment, and public comment is closed. You cannot do that.
Sir, the alderman can speak their piece. If you were an alderman, and I suspect you'll want to be one after this, then you'll be able to do that.
You can't do it.
Sir, I'm sorry, you need to be quiet.
It's against Robert's Rules of Orders.
Samantha, do you have Ted? He's wanting to speak.
Hey, Ted.
All right, I got you. Okay. Are we good? Okay. First thing, I just want to make a point of order. That did not appear to be Alderman comment. That appeared to be public comment. So I'd like that. I want to ask the city attorney, as the ordinance is written, would it not mean that if it passed, we would instruct the school that football and basketball players would have to wear a mask or be socially distanced 6 feet apart from one another? Is that correct?
That's correct.
Well,
That's correct.
Ted, that is correct, the way the ordinance is written. Okay, I'm sorry, that is correct, the way the ordinance is written. The way there is a statement in the ordinance, let me find it. Oh, it's under exceptions, and it says, under such circumstances identified in any subsequent order issued by the mayor. So this would allow me to make an exception for that in high school sports.
Okay, on the record, I would be absolutely positively against that. And second, I would like to know, before that would even be considered, is there a valid medical reason that would say that high school sports is a no risk of transmitting COVID? Because my argument would be, what is the difference between high school sports and a pickup game at the OC? If I've got 3 members of my family playing a basketball game at the OC, I'd be required to wear a mask unless I was able to maintain 6 foot distance. But we would allow the school because of what reason, what medical reason would we allow the school an exemption? I'm not asking you to answer that because I know you haven't done that. I'm just making this for the point that I think that is a very bad clause in this ordinance. And probably, if for no other reason, I would vote against this ordinance just for that reason. And that's the end of my comments at this point.
All right, let me ask you a question just for clarification, Ted. Which clause are you talking about is bad? The fact that they have to social distance, or the fact that the mayor can make alterations as we get into this and find out that there are things flawed that need to be changed? Which
I think if there's, my personal opinion is that if we're taking the time to go through this as a board of aldermen and we vote for certain exemptions, then we can take the time to add or subtract additional exemptions at that point. If there's something so emergent, I would want our medical professionals to tell us what it is. And all due respect to you, sir, and as you know, all due respect to you, for anybody in that position, I don't care who was in that position, I would not want that person unilaterally making a decision after the board of aldermen has voted. In principle, I just don't think that's, I would want our medical professionals coming back before us, telling us why we have to add or subtract.
Well, I want to agree with you. I don't want to make that decision by myself. If you remember, the very first emergency order that came out anticipated that there would need to be some minor changes as we came out of the shutdown, and we used that mayoral power to do that. Technically, I had the power to do that with the mask ordinance, but I chose not to do that because the public needed to have input, even though that's been questioned tonight. And it was my idea, and I looked for an alderman who wanted to sponsor this so that we could put it on the table and discuss it. Otherwise, we would have done nothing, and the people that were in favor of it would have not had a say. The people that did not want one would have gotten their way because we would have done nothing. So I don't want that responsibility either, I assure you.
Oh, and I agree. And none of that was directed at you, sir. That was
Well,
generically, you're not in that position. I would not want them to have that authority.
no, I didn't take it that you were directing at me. I'm just trying to clarify things. So,
Yes, sir.
anybody else, any other alderman, have anything?
He did call point of order, though, on the public comment, nobody addressed that.
Well, it is,
One of your aldermen did.
okay. So, Amanda, what would be the procedure? Do we just redact that?
There's no issue. The city of Ozark adopted their own rules of order. They do not follow Robert's rules of order. Their own rules of order allowed what Alderman Galloway said, that each alderman is allowed to speak to the bill. And very technically, that should occur at second reading, but they're doing it now, so it's fine. But, you know, everything is moving as it should under our rules of order.
That is
Thank you.
not public, that is public comment.
Thank you, city attorney.
I'll
All
be
right.
bringing this up later, just so you know.
That's fine.
Yeah.
All right, any other alderman comment?
Another lawsuit coming this way.
Mr.
Answer
Flores.
got one?
The only thing I would like to say is that I'm not disputing that COVID-19 exists, and we know a lot about it, and I'm not disputing that masks will help slow the spread. I think we kind of have a little bit of a tripod with masks and knowing that keeping our hands clean and also keeping our social distancing is all ways to help slow the spread. I think that no one can really answer how well any of those are going to work definitively, not even our health professionals. And I do think that we're very divided on that. So for me, I find that when I go to Springfield, which I have to go to Springfield all the time, I see certain places that really do well at adhering to the mandate. And I've also been in places in Springfield that don't adhere to it at all. And I think that really comes down to the fact that it really is on the business owner and it really is on the individual on how well that works. And I think that we should be trying to do that as a community and as a personal responsibility. I've been wearing a mask more. And I think the reason why is just because no one's telling me I have to wear one, but maybe I feel like I'm being more responsible when I do. I don't know how much it's helping, but it makes people feel comfortable and that's enough for me. But that's my choice. So I think that one thing we really need to consider as a community is what divides us as a community and what's the best way for us to move forward without further division. And so for me, that's one thing I have a hard time with when I'm looking at my neighbors and I'm telling them, I don't know how much this is going to help. No one can tell me how much this is going to help, but I'm going to find you and I'm going to come in and tell you what you're going to do based on, I don't know, no real fact. And don't get me wrong, I'm not saying that COVID isn't real and I'm not saying that masks aren't going to help. But I do think that we need to be careful about how we move forward with this, just to make sure that we're not overstepping. And that's really the only thing I have to say about that.
All right, anyone else? Mr. Smith, any further comments? Okay, that appears to be the end of alderman comments. Mr. Postman, I'll put it in your hands at this point since you're the sponsor.
Your Honor, I'm going to ask that this bill be held over for second reading on Monday, August 17th.
All right. All right, if there's no move to expedite, it would automatically go to the next legislative session, which is the 17th. So let me. All right, so that concludes all of the comment, and we will carry this over. This is the typical way of doing it, unless an alderman decides that they would like to ask that the bill be expedited, because it can be passed on the first reading. Well, not on the first reading, it's discussion only, but it can be passed on the same night as the first reading if someone wants to make that motion, and the sponsor has chosen not to. So it looks like there will not be a decision tonight. I really appreciate all of your all's comments and your passion. Some of it's not been real friendly, and I understand that. I'm not offended by that. I'm not mad about it. I just, it's a passionate topic, and I get it. We've been facing this for a long time. since Friday, I have gotten 54 calls, texts, or emails. If anybody's interested when this is over, I'll be happy to tell you because I've tallied them. But it doesn't make any difference. We're not going to vote on it tonight. It will be a second reading bill on the 17th, which means it will be voted on with zero discussion, no public input. That was over tonight. So I have a question in the back row. Ms. Hill? A question only, not comment. Yes. Okay, I appreciate that, but our rules of order are what they are. And the public discussion is, in fact, all discussion is over, except what any alderman might want to do on the second reading. So I'm sorry. No, I'm sorry, but you can't make motions and second it. No, we're not changing rules. All right, let me suggest if you have some information that you think we ought to look at, that you would provide that. I'd be happy to get it to the alderman. I'm just telling you that the way our meetings are run is according to the rules of order that we have adopted, and someone cannot make a motion from the floor. An alderman can, but a member of the public cannot. So if you think that's disrespectful, then the revised statutes in the state of Missouri are who you need to take it up with, not me. So we will hold this over, Mr. Davis. Probably will. Yeah, because it will probably be a big one. And I apologize to all of you all and everybody that's listening for the technology. We just don't have the facilities at City Hall to handle a crowd like this. And so we are thankful for the school district for letting us borrow some of their technology because it's clearly not working as well as people would like for it to, but that's the best we have. And so I think we did very well with what we had. And thank you, Samantha. Yes, Heather. Well, I thank you for saying that because I know there's some people that probably don't agree with you, but it was necessary, even if it was painful, to have it discussed. And so I think we've accomplished that tonight. And so if there's no other further discussion, do I hear a motion from an alderman to adjourn?
So moved.
Second.
Motion's been made and seconded to adjourn. All in favor, say aye.
Aye.
Thank you all very much.